Welcome. If we can start getting seated. I may have to stand on my tippy toes. Thank you all for joining us this morning. I hope you had an okay time finding the Showcase Theater. It's a little bit of a drive, but I really love this space, don't you? Isn't it nice? Really warm. Good morning and welcome to First 5 Marin Communications Forum. It's wonderful to see so many beloved faces, community advocates, and partners gathered today to share in purpose. Before we begin, I want to take a moment to recognize someone very special to First 5 Marin and to our community. I want to recognize Michelle Fideli, whose years, yes, let's clap for her. Whose years of dedicated work have made gatherings like this possible. Michelle has ensured that organizations and community members across Marin have access to timely, accurate, and vital information, helping us stay informed, connected, and ready to act. And I want you to hold that, ready to act. Her commitment to this community and to the forum's mission continues to inspire us all. Thank you, Michelle. Putting together this forum today has been a labor of love. It has been something that Michelle has put her heart and soul into, so I hope you see that reflected in the programming today. As Executive Director of First 5 Marin, I am proud that our organization helps support these conversations because the well-being of our youngest children and families depends on strong systems, informed leadership, and collective advocacy. Today's discussion reminds us that the federal policy decisions reach directly into our local classrooms, our organizations, our clinics, our neighborhoods, and that we have a shared responsibility to respond. Without further ado, I want to welcome Laura Morgan Kessler and David Wetmore from Carpy and Clay. Yeah. Oh, well, we have a special surprise guest today, and I could not be more excited. It is my honor to introduce someone who has long been a steadfast champion of Marin's families and communities, our Congressman, Jared Huffman.
Thank you, folks. Good morning. I know that I'm not on your agenda this morning, so a little bit of a surprise appearance, but I'm really grateful that you gave me this opportunity. When I heard that there was this gathering going on of folks that are doing such important work, that are such a critical part of the fabric of this community, from childcare to any number of other critical services, I wanted to come by and just tell you how much I appreciate you. I know that your agenda is going to take you through some pretty grim news. You're going to be looking at how all of this chaos and these budget cuts at the federal level are trickling down into the services that the County of Marin and the state and many of you as NGOs are trying to deal with. So I just wanted to take a moment to let you know that every one of these cuts, every bit of this bad news that you're going to be talking about today, I have fought against at every step, and you have my commitment that I will continue to fight against. If there was some single thing I could do or tell you this morning to make it all go away and to make it better, believe me, I would do it. I would like that very much. Unfortunately, I think we're all kind of in this together. We all need to pull together and forge a way through this really difficult and scary and surreal time. And it's about a heck of a lot more than any one program or any one line item in the federal budget. It's really about the bigger picture, the unraveling of our democratic republic and trying to hold it together. So that's the moment that we're in. It's big and it's real and it's tough. And it's going to really require all of us to have each other's back and to remember that as this threat comes at our entire fabric of civil society, we all have a stake in each other. And just because the fight one day may be about some group that we think we don't belong to or we don't have a stake in, we do have a stake in that. Because all of us who are part of civil society in this democratic republic stand to lose big time if this authoritarian push and these billionaires and plutocrats that are running the show, if they continue to have their way. So it's going to be tough. It's not going to be something that we can resolve quickly, but I am confident that we will get through this together and we will come out the other side. And so I'm grateful to everybody who is going to be briefing you this morning and trying to find some Band-Aid solutions to get us through this bridge period until we can get our country back on track. I'm really grateful to the state of California that is going to be probably asked to backfill for so many of these things, and I know that your lobbyists and advocates will be talking to you about creative workarounds to try to make that happen. So that's really why I just wanted to be here, to tell you that the work you do is very important. It is very much appreciated. And to just promise that I'm going to be part of this team effort to get us all through together, and we will get through. So hang in there, and good luck today. Thanks for everything you do.
Thank you, Congressman Huffman. That cannot have been easy to say, but I think he said it to people who are ready to get to work, so thank you so much. Next, we have the Outlook from Washington, D.C., brought to us by Laura Morgan Kessler and David Wetmore of Carpy and Clay. They are Marin County's federal lobbyists. Thank you, Laura, for being here. Thanks. Thank you, David.
Hi, thanks so much. Hopefully everybody can hear us okay. We appreciate the opportunity to be with you virtually today. Both David and I are here in Washington, D.C. I'm going to start by providing a brief update on where we are regarding the government shutdown, and then I'm going to hand it over to David, and he's going to talk a little bit about H.R. 1. So we are currently on day 24 of a federal government shutdown. We got here because the federal fiscal year ended on September 30th. And unfortunately, Congress was unable to pass any of the fiscal year 2026 appropriations bills by that September 30th deadline. And Congress was also unable to pass a short-term continuing resolution, or CR, to allow the federal government to remain open for a period of time. So as of October 1st, the federal government has been shut down. What this means in practice is that the majority of federal agency staff are furloughed, so they are not currently working and they're unable to do so. In fact, they're prohibited by law from working during a shutdown. And the small amount of federal agency folks who are still working during the shutdown, the activities for which they can undertake, also by law, are very limited in nature. So for those of you in the room over the last now, I guess, almost 4 weeks, if you've tried to get in touch with folks at federal agencies and have been unable to do so, it is likely because they are furloughed and are unable to respond to you at this time. We are seeing Congress, both the House and the Senate, kind of take two different approaches to the shutdown. We'll start over in the House. On September 19th, the House of Representatives passed a 7-week short-term continuing resolution, mostly on a party line vote, and then sent that over to the Senate for consideration. That September 19th date is actually the last time the House was in session. So Speaker of the House, Mike Johnson, has chosen kind of each week of the shutdown to continue to keep the House in recess and members home. His position has been, the House has done its job, it's passed their CR, and so there's no reason for them to be here until the Senate does its work, passes the CR, and reopens the government. Over on the Senate side, the Senate has been in session most days since October 1st. They vote once a day, every day they are in session on this House passed CR. Senate Majority Leader Thune really felt like by continuing to have senators vote on this bill, that at some point fatigue would start to set in, and he may pick up some additional Democratic votes in order to get this passed. So in the Senate, we have to get 60 votes to get it passed. Right now, we are sitting at 53 votes in support of the current CR. So every day, yesterday was the 13th vote that the Senate took on this CR. It is the 12th vote that has remained the same. So we are not seeing any movement of additional Democratic senators. So we are continue to be in this stalemate. The Senate has gone home for the weekend and they will come back on Monday. So at this point, the absolute soonest we could see the shutdown end is Monday, October 27th. But I don't realistically think that there's anyone in this town, really including David and myself, who think that that's what's happening on Monday. So, I think there really is the expectation that this is going to continue to go on, likely at least through next week, potentially even longer. Both sides continue to be very dug in. And in fact, I think even more so now than when we started the shutdown on the 1st. So at this point, it is really looking like there's going to need to be some additional outside change or force to really change the trajectory and to bring members to the table to try and get us out of the shutdown. I talked a little bit about what happens at federal agencies. From a congressional standpoint, each member of Congress gets to determine how their office functions during a shutdown, similar to what happened in COVID. Based on what David and I are seeing, most members, their offices are up and running, operating as business as usual. However, like federal agency staff who do not get paid during a shutdown, congressional staff don't get paid during a shutdown either. So this is my one plug to you all in the room, that if at any point during the shutdown, you need to reach out to someone in Congressman Huffman's office or in your senator's offices, please be extra kind, as those staff are working without pay. And make sure to thank them for the service they're providing at this moment. So that's a little bit in a nutshell of where we are in the shutdown and where we may be moving and how we may or may not be getting out of it. I'm going to hand it over to my colleague David, who's going to talk specifically about some of the impacts of HR 1.
Thank you, Laura, and good morning, everyone. It's great to be with you. For my part, I'll talk about what they call the One Big Beautiful Bill Act. I'll call it ABBA, or OB3, to save you from that title. Signed into law on July 4th, and as Mr. Huffman very nicely put, we have become the bearers of bad news lately, and apologies for that. As a reminder, I always want to kind of set the table of how this happened. Because the Republicans control the House and the Senate and the White House, the Republican majority was able to rely on a procedural process called budget reconciliation. This process bypasses the Senate's filibuster rules and merely needs a simple majority. So while bypassing the filibuster, it also bypasses any need for bipartisanship. And unfortunately, reconciliation wasn't intended to work that way. It's rarely used because you need to have control of all branches of the government, but there is precedent. 2017 tax cuts, the American Rescue Plan during COVID, and most recently, the Inflation Reduction Act when Joe Biden was president. This law, OB3, consolidates far-reaching Trump and Republican priorities into one massive bill: new tax cuts, extensions of existing tax cuts, but also undoing many Biden initiatives like the clean energy tax provisions that were from the Inflation Reduction Act. It also makes significant changes that will impact shared federal, state, and now county public safety net programs and funding. So Medicaid, food stamps, a SNAP program. I see this as a fundamental reshaping of the intergovernmental partnership that has existed for many years between the federal government, state governments, and county governments. So given the fact that SNAP and Medicaid are county administered programs in California, there are very real fears of cost shifts to the county and community partners, loss of healthcare coverage, increases in uncompensated care, and broader burdens on the healthcare system, hospitals and providers. For one example, doesn't receive much attention. Kaiser Family Foundation reports that 60% of nursing home residents have Medicaid as a primary payer. There are about 15,000 certified nursing homes in the country. In addition, community health centers as well also rely on Medicaid for funding. So there will be big impacts on access, services, and staffing. And there's the big fear that safety net providers, county-owned hospitals, safety net providers, will be closing. We're already seeing strains in the system. So over the course of my career, first in federal government, state government, and now as an advocate for counties, I've concluded the following. The federal government has all the money. The states have all the power to write the rules, and counties are left to figure it out, make the law work, and be accountable for the results. And of course, everything's flowing downhill, and all the community partners that are assembled in that room, you'll be feeling these impacts. So what are we seeing? The feds are pulling a lot of money out of the system. The Congressional Budget Office estimates the health provisions overall will reduce federal outlays by $1.1 trillion. Based on what I'm seeing, the state of California is going to be hard-pressed to backfill this spending gap. If the state will not or cannot, who will? Counties are being put in a very difficult position. So I had the good fortune of looking at the slide deck for your next presenter. It's very thorough. So in the interest of time, I'm just going to reference a few of the provisions, kind of as a segue to that presentation. All of these provisions I'm going to talk about and others impact funding, who's going to pay, eligibility, who qualifies, who gets care, and of course, the all-important access to care. I'll talk about one that's probably not on the tip of your lips. It's called Medicaid Disproportionate Share Hospital Funding. This is a program that was repealed by the Affordable Care Act, the belief being that everyone was going to have coverage of some sort. But this was proven to be wrong. So every 2 years since enactment of that law, a bipartisan Congress has delayed that funding cut. Many saw ABBA as the vehicle to reinstate the program. Did not happen. On October 1st, an $8 billion reduction in these DISH payments was triggered and is technically underway. This will have a massive impact on the ability of safety net and public hospitals to mitigate the costs of uncompensated care. But this may be averted. Laura talked about the continuing resolution funding bill. There is provision included in that pending bill that would further delay these cuts. But there's no certainty in the current environment. Let me talk quickly about work requirements, community engagement. States will be conditioning Medicaid eligibility for recipients aged 19 to 64 who aren't pregnant, not entitled to Medicare, and not otherwise exempt. Counties will have a role in the policing of this, staffing and costs. Medicaid cost sharing. There is now going to be imposed a new out-of-pocket cost on low-income Medicaid enrollees starting in October 2028. You'll note that's after the presidential election. State-directed payments. This is a tool of flexibility that states and counties use to direct managed care organizations to pay specific providers at certain rates, usually to address underpayments or incentivize care models, especially for those serving vulnerable populations. This flexibility is going to be capped. And talking about, state rules, county administering the programs, There are going to be new semi-annual eligibility determinations beginning in 2027. There will be monthly address check-ins, quarterly death checks for enrollees, and monthly provider eligibility and death screenings over the course of this law. Who's going to be doing this work? The county is already responsible for determining eligibility for many of these programs. Provider tax restrictions, talk about money. California has a law that provides for levy taxes from providers. Those funds are used, those revenues are used to enhance or leverage more federal funding. California's provider tax is about 6%. This is now capped and will be reduced down to 3.5%. It's a lot of money coming out of the system. We can talk briefly about the Affordable Care Act premium subsidies. The next speaker will talk to that in length. That's the key issue right now in the government funding discussions. But November 1st is the day when we're going to start seeing all those plans and the costs associated with them, and it's going to be pretty bad. Food assistance, SNAP. I think there was a March report, some 5, almost 6 million Californians, about 14% of the state relies on SNAP food benefits. 63% are children or they're elderly. I'll get to ABBA in a second, but as you probably know, with the government shutdown, there is no longer SNAP funding. California has announced, and several other states have announced, that the November benefits are not going to be available. Therefore, this is a program that is lapsing. There's also concern, women, infants, and children, usually the canary in the coal mine when a government shuts down. That program received $300 million to stay afloat, but that money will not last forever. And now OB3 and SNAP. For the first time ever, states are now going to be required to pay a share of program benefits. This is county administered. How will the state write the rules? Administrative costs. Right now, states pay 50% of the administrative costs. This law increases that to 75%. What's the county role? What's the county cost? Who administers? What are the rules? And finally, work requirements. Obviously, work requirements are in place to move people out of the system. Where do these people go for help and care? Generally speaking, counties are the provider of last resort. So I'll stop there. Hopefully that tees up your next presentation. But we're in for a lot of tough work here to try and sort through this. So with that, thank you very much.
Thank you, David. Thank you, Laura. We appreciate your honesty with us. Thank you. I'd like to call our next presenter up on the stage. Laura is going to provide us with a statewide perspective on funding cuts, and Laura Pryor is the research director at the California Budget and Policy Center. Thank you so much, Laura, for being with us today. Oh, the other Laura.
Hi, good morning. As mentioned, my name is Laura Pryor, and I am the research director at the California Budget and Policy Center. For those of you not familiar, we are a nonprofit that does research and analysis on our state budget, and now, given what's happening, also our federal budget, which is what I'm here to talk to you about today. So before diving into the specifics, I want to set some context. My slides, oh, there we go. So one of the things that the Budget Center likes to say is that budgets are statements of our values and priorities as Californians. So if we value childcare, if we value healthcare, if we value access to healthy food, we should see that prioritized in our state and federal budget choices. And we know that prioritizing economic security for Californians is more important than ever in our budget choices. Poverty is on the rise in California. Specifically, we hit a low in 2021 for child and overall poverty. Much of this was due to expanded pandemic-era supports, such as the expanded child tax credit, expanded food assistance. Those expired in 2021, and as you can see, since then, we've seen a steady increase in poverty over the last few years. So we know that now, more than in recent years, families are struggling to meet basic needs and address the high cost of living in California. And we also know that families in Marin County are not insulated to this issue. So the Budget Center recently published a new tool called the Women's Wellbeing Index, which was put out this time last year, that talks about the state of women in California for each county. And this tool revealed some very interesting statistics about Marin. Primarily, 41% of women in Marin County are paid low wages. And I want to point out that this is the 5th highest percentage across all 58 counties, meaning that women in Marin County face disproportionately higher, more low-wage work compared to other counties. And we know that this impacts families' bottom line. So women in Marin County, on average, spend about 33% of their income on rent and about 45% of their income on childcare. We know that this is too high, and this is really impacting, again, families' abilities to meet their basic needs. In fact, about 33% of women in Marin County with low to moderate incomes struggle to afford enough food. So again, thinking about that increasing poverty line, we know what's happening federally is only going to exacerbate that poverty line and also impact families in Marin County. So now I want to get into some of the specifics. And to do that, I'm going to start by talking about what's happening at the state level. It's really important to understand our state context for understanding federal impacts. So after I do that, I'll get into some more specifics about how what's happening federally impacts California, and then I'll conclude with some implications for counties. So again, starting with our state budget overview, as mentioned, in order to really understand what's happening at the federal level, it is important to know what our state context is and what the fiscal outlook is looking like for California as we head into these actions that are coming down from the federal government. So the first thing that I like to tell people about our state budget is that it's made up of two primary sources, state funds and federal funds. So the state funds and federal funds flow into our general fund for our state budget in California. And of these state funds and federal funds, about 1/3 or about 35% come directly from the federal government, and about 2/3 comes from our state revenue sources. So when we're seeing impacts at the federal level in terms of those cuts to programs and services, that's really eating into this dark blue part of the donut chart that we have here, forcing the state to think about, are we going to increase the light blue, or are we just going to shrink the whole pie altogether? So as mentioned, 2/3 come from state funds, and it's also important to understand where these state funds come from in order to know about the fiscal outlook for California. So specifically, on the state side, our state revenues primarily come from 3 main sources. And these are personal income tax, so the taxes that we all pay every year, sales and use tax, so taxes on goods and services, and corporation tax, so taxes that businesses pay. So you might notice that these are all, again, connected to taxes that are connected to how the economy is doing. So when we face uncertainty in our economy, such as through what's happening with tariffs and other economic shocks, that is impacting the amount of money that is coming into the state, into our state's general fund, and the amount of money that the state has to then fund programs and services. So the bottom line here is that California's state budget is very much subject to the economy. So again, when we're facing times of economic uncertainty, we're also facing uncertainty in the amount of money that's coming into the state to fund our programs and services. So with that said, I want to talk a little bit about what happened with the state budget for the 2025-26 fiscal year. So overall, just as some context and scope, our state budget from 25-26 spent about $228 billion from our state's general fund. And you might be wondering, you might have heard about deficits in years past. So this past year, we had a small deficit of about, relatively small, $7.3 billion. And when the state faces a deficit, leaders have to decide how they're going to close this gap. And in the last budget cycle, the state did this in a few different ways. Primarily through some fancy accounting, basically some internal borrowing money from special funds to help offset our general fund, and also borrowing money from, for example, proposition bond dollars to, again, offset our general fund dollars. However, about a quarter of the spending of the state budget, closing the state budget, came from spending reductions. So these are the cuts, delays, and deferrals to the programs and services that we know families in California need. And I want to talk about one specific area that the state focused on to close this budget gap, and that was access to health care for immigrant communities. Unfortunately, the 2025-26 state budget did include some cuts for our immigrant populations in California, and I want to highlight these given what's happening at the federal level, as we'll talk about next, really only exacerbates this issue for our immigrant communities in California. So specifically, in the 25-26 state budget, it freezes new Medi-Cal enrollment for undocumented adults ages 19 and older starting in January 2026. So again, starting this coming year, if you are an undocumented immigrant in California, you can no longer enroll in Medi-Cal. However, state leaders did agree on a 3-month re-enrollment period and protections to prevent people from aging out of the program. Secondly, the state budget imposes a burdensome $30 monthly Medi-Cal premium for certain immigrants ages 19 through 59, starting in July 2027. So if you think about a family of 4, that's $120 a month, which we know can really impact a family's budget and ability to meet basic needs. However, I do want to note that the state did make a provision where pregnant people are excluded from this cost-sharing requirement. And lastly, the state budget eliminates Medi-Cal dental benefits for certain immigrants starting in July 2027. So again, overall, we are seeing our state budget choices and how the state decided to close the deficit impacting our immigrant populations in California. We also know that given the state's fiscal outlook, the state also failed to advance key economic security challenges that we know families are facing in California. For example, with housing, in our state budget from 2025-26, we really only saw limited one-time allocations for affordable housing and homelessness, signaling that the state really hasn't made the bold and needed investments to address housing affordability and homelessness in our state. Childcare. We're not seeing any new subsidized childcare spaces funded in the 2025-26 budget. Again, families' ability to afford childcare, this state budget does not expand those opportunities. We're also seeing delays in the state paying childcare providers the true cost of care. We know that childcare providers are not paid a fair wage, and the state is continuing to delay paying providers this true cost of care. So again, overall, in our 25-26 budget, the state had to close a shortfall of about $7.3 billion, and they did so by about a quarter of the solutions, those cuts, delays, and deferrals to key programs, which, as mentioned, directly impacted our immigrant populations, which we know only exacerbates the context that these populations face in California right now, given the unprecedented harm and ongoing ICE raids that are currently happening. Because of this, at the Budget Center, we think that state leaders can do more to ensure that all Californians can make ends meet. So given this, you might be wondering, well, what does the fiscal outlook look like for California in the years to come? To what extent do we think state leaders might be able to address these needs that we know are critical for our families in California? So as a reminder, this is our state budget timeline. So every year, the governor must release a proposed state budget by January 10th, a revised version by May 14th, and a final budget is typically signed by late June, early July. So point being is we'll know more about how the state is going to be responding to our fiscal outlook and what's happening federally come January 10th of 2026. When the governor releases his proposal, again, that should include more details around not only the fiscal outlook, but the governor's proposed solutions to addressing the harms that we know are coming down at the federal level. However, what we know right now is that the state does face an uncertain future. So the Legislative Analyst's Office, or the LAO, recently put out a report showing this chart here, which essentially shows that the state is going to be facing deficits in years to come, meaning that the state is going to have to continue making those really hard choices about, are we going to be able to do more accounting maneuvers, or are we going to have to do some cuts, delays, and deferrals to those key programs and services that families rely on. I also want to mention that the 2025-26 state budget really didn't include much by the way of the federal harms that we're anticipating in the years to come. There were some changes, such as enhanced funding for food banks. However, by and large, the budget does not include any funding to backfill the anticipated benefits for individuals that might come in the 2026-27 budget, which again will be dropped by January 10th of this coming year. However, in the slides that I'll show next, and underscoring this uncertain future, it's unclear to what extent the state is going to be able to do so. So with that, I want to talk a bit more specifically about what we can expect in California, given what's happening federally. So as a reminder, about 1/3 of our state budget comes from these federal funds. So I want folks to keep this in mind as I'm going through my next slides that talk about not only how things have harmed the federal government, or how the federal government is impacting families in California, as well as the state's bottom line and its ability to pay for the programs and services that Californians need. And I'm going to start with health. So specifically, as mentioned by our previous presenters, H.R. 1, the One Big Beautiful Bill, I'm just going to call it H.R. 1, enacts the deepest healthcare cuts in history, slashing $1 trillion nationwide from Medicaid over the next decade. An estimated 10 million people across the country will lose health care by 2034. Now in California, specifically, about 3.4 million Californians could lose their Medi-Cal coverage, and the state could lose about $30 billion annually in federal funding every year due to H.R. 1, again, threatening care for millions and destabilizing the entire healthcare system. So again, think about this 30 million in relation to that dark blue part of that donut chart. It is certainly going to shrink. So with regards to specific impacts and when they're going to happen, first, by October of next year, for Medi-Cal specifically, our state's Medicaid program, we're going to see H.R. 1 exclude certain immigrants from Medicaid or Medi-Cal and the Children's Health Insurance Program, or CHIP, including most humanitarian groups. And what this means for California is that California will no longer receive a 90% federal funding match, again, eating into that dark blue part of our state's general fund. Come January 2027, we will see increased eligibility checks for our Affordable Care Act, or ACA expansion adults. So right now, eligibility checks are once per year. This is going to go up to twice per year. This will result in about 400,000 adults in California might be losing their Medi-Cal. And also, we have to think about the administrative burden on counties to have to go from 1 eligibility check per year to 2 eligibility checks per year will certainly be an additional administrative burden for our county staff. Also at this same time, we will be seeing the H.R. 1 limiting retroactive Medi-Cal coverage for adults, so retroactive coverage meaning paying for past due medical bills. So as a result, about 86,000 adults per year in California would receive only 1 month of retroactive coverage instead of 3 months. So again, eating at people's bottom lines and ability to afford basic needs because healthcare costs will be going up. And lastly, those work reporting requirements that the previous presenter talked about, we'll see those go into effect October 1st, 2027. They are ineffective and burdensome, and it's going to result in about 3 million adults potentially losing their Medi-Cal in California. So these are the main provisions I wanted to talk about with regards to Medi-Cal. However, I also wanted to talk a little bit about Covered California, so our state's marketplace program for healthcare. So the main things I wanted to talk about here is come January of this coming year, we'll see those premium tax credits expire, as the previous presenter mentioned. So this is going to raise healthcare costs for about 1.8 million Californians. Again, eating away at people's budgets, healthcare costs going up. Come January, we'll also be seeing the end of marketplace subsidies for certain immigrants. And in California, this will impact about 112,000 covered California enrollees. So that's what's happening with regards to HR 1's impact in California for healthcare. And I want to talk a little bit about food assistance. And unfortunately, the news here is not any better. Overall, across the nation, HR 1 is going to raise costs and reduce food assistance for millions of people by cutting federal funding to the Supplemental Nutrition Assistance Program, or SNAP, or CalFresh in California, by $187 billion through 2034. This is about a 20% reduction in the overall SNAP budget. So for California specifically, the implication is about 97% of CalFresh families are at risk of losing some or all of their monthly benefit. So specifically, we're seeing HR 1, there's TBD here because we're waiting on further guidance from the USDA in terms of when it will be implemented, but we'll be seeing an expansion of harsh time limits, so essentially the amount of time that people have for their work reporting requirements. We'll see this expanded to older adults, caregivers, veterans, former foster youth, and people experiencing homelessness, essentially putting these populations in a more precarious place with retaining their food assistance. Secondly, we'll see HR 1 block SNAP enrollment for certain immigrants who are not naturalized citizens or do not have a green card. Come October of next year, we will see HR 1 forcing states to pay a larger share of SNAP administrative costs, and the following October, we'll see those cost shifts. So HR 1 is going to shift up to $1.8 billion in SNAP benefit costs to California. So again, we saw that $30 billion number for Medi-Cal, and we're looking at adding on top of that for CalFresh, again, eating away at that dark blue part of our donut chart for our state's general fund. So in terms of what these SNAP impacts look like for California, for CalFresh, overall, over 3 million California families are poised to lose some or all of their benefits. And underneath this 3 million, to provide a little bit more detail, we'll see those ineffective work reporting requirements put about 125,000 Californians at risk of losing some or all of their benefits. And talking about those time limits, about 243,000 Californians in households with non-disabled older adults would also be at risk of losing some or all of their food assistance because of those expanded time limits. And thirdly, the restrictions that we saw on certain immigrants will take food assistance away from 74,000 Californians. And again, thinking about the state budget, in total, cuts to SNAP are estimated to cost the state between $1.7 billion and $3.7 billion annually in lost federal funding. Again, shrinking that dark blue part, forcing our state leaders to have to make even harder decisions. Now, I would be remiss if I didn't mention that all of these cuts to healthcare, to food assistance, are really, in large part, going towards tax cuts for the well-off. So at the national level, HR 1 includes about $4.5 trillion in tax cuts for individuals and corporations across the nation over 10 years. And this is really concentrating wealth for those that already have it. So the top 1% is going to be claiming $1 trillion of the benefit. In California, what this looks like is the top 1% will receive an average annual tax cut of $35,000, while the bottom 20% will receive just $100 on average. So thinking back to that poverty chart, not only is poverty going to be on the rise, given what we're seeing in HR 1, but income inequality in California, which we already know is a problem, is certainly also going to expand, given what's happening with our tax system in HR 1. So that was a lot of news and not great news. And I want to talk a little bit about what's next for counties. As our previous presenter mentioned, all of this does fall on the backs of counties. Specifically, we know that state and federal revenues make up the top 3 revenue sources for counties in California. So as I talked about, we're certainly getting less money from the federal government, and the state is definitely in a precarious financial situation given the economy and federal cuts, which will definitely impact county budgets. In addition to all of that, we will see increased costs for counties given the additional administrative burden, for example, increased eligibility checks going from once per year to twice per year, which will definitely impact the bottom line for counties. So I want to talk a little bit about a few examples of how some counties have already been responding to what we're seeing happening at the federal level. First, in Los Angeles County, just as some context setting, they're projecting about $800 million in HR 1 related cuts and about 5,000 county health department jobs at risk. LA County has recognized that their residents may be poised to lose some of their benefits, and as a result, they've been proactive to launch what's called a Keep Your Coverage campaign to help connect residents to critical resources to help them maintain Medicaid and SNAP enrollment. Some of our partners have been very concerned about with the increased complexity of what's happening with Medi-Cal and CalFresh with regards to eligibility. There might be a lot of misinformation spread about who is and is not eligible, and LA County is being proactive about making sure that they are combating any misinformation and putting information out there to help make sure that their county residents are able to keep their coverage for those that are eligible. Secondly, in Santa Clara County, they're projecting about $1.4 billion in HR 1 related costs, and I'm sure as many of you have heard, they've recently launched a sales tax measure, I believe it's about 0.6% sales tax, aimed at raising $300 million to help offset the cuts that they might project from HR 1. And to help bolster their Measure A campaign, they also launched a PR campaign to bring attention to the impact of these cuts. So these are just a few examples of how some counties have already been responding to what we're seeing at the federal and state level. And I want to also pose a few final implications for counties as you all move into your next panel discussions. So primarily, a key thing that counties will have to consider is implementing new HR 1 requirements, those administrative costs. So how will counties ramp up staffing and IT to address the increased administrative burden? Another implication are thinking about those reductions and reallocations in county budgets. So we know that there's less coming in for healthcare and food assistance from the federal government, and the state may be very unlikely to help backfill that. So are counties able to reduce some areas of their budget and reallocate to healthcare and food assistance to help offset some of the damages that we know we'll be seeing from the federal government? Thirdly, in addition to Santa Clara County, will some counties try to raise local revenue to address federal actions and grow the pie in counties to offset some of these cuts coming down from HR 1? And lastly, to what extent will counties be forced to cut services? Unfortunately, some counties may have to cut services that help families meet basic needs, and to what extent will this county have to go down that path? And I want to end by noting and going back to where we started with budgets are statements of our values and priorities. And as counties consider how they might address what's coming down from HR 1, in my opinion, it's important to put that front and center and consider the impact on children and families when counties are thinking about how to balance their own budgets and potentially backfill for the federal gaps that we will be seeing. Now, I know that's a lot of information that I just shared, a lot of stats, a lot of updates, and I want to plug our website, calbudgetcenter.org. We have a federal policy page which provides a lot of information in much greater detail about what's happening federally and the impact on California. So I invite you to visit our federal policy page. We also have a newly launched Budget Academy, which provides videos, tutorials, guidelines with regards to how the state budget process works. So if you're curious for more information about our state budget process, please visit the Budget Academy on our webpage. And lastly, feel free to reach out to us directly if you have any questions. We're always happy to provide technical assistance to our community partners whenever needed. Here is my email address. Feel free to reach out if you have any questions. And with that said, I'm happy to take any questions now if there's anything I can help address. Thank you. Yes, thank you so much for your question. Raising revenue does not have to mean a sales tax. Raising revenue can be a wealth tax. It can be a parcel tax on real estate. It can be what we call a progressive tax measure instead of a regressive tax measure, which would be a sales tax because that taxes everybody. I'm much more informed about statewide revenue raising options. So for example, at the state, if we wanted to eliminate offshore bank accounts for corporations, that would raise about maybe $5 billion annually in additional funds for our general fund. So at the county level, I don't think that there's a similar push for corporate tax reform, but there are progressive tax options to allow the county to raise revenue in a way that wouldn't impact the county's most vulnerable residents, particularly through a wealth tax or some sort of real estate or parcel tax. And I'm happy to answer more questions if you want to follow up with me offline. Yeah, so just as some context, California is what we call a donor state in that we actually send more money to the federal government than what we get back. And I was actually at a meeting with Attorney General Rob Bonta, and this same question was asked to the Attorney General, and his response was that he has sought counsel on the extent to which this would be possible. However, the mechanism for withholding state dollars for federal taxes isn't very straightforward. So it's not that our federal taxes go to the state, then go to the feds. We just send our dollars to the feds. So in that sense, it's logistically very challenging to be able to actually withhold federal tax dollars to then keep them for the state. So unfortunately, I think, in my opinion, Governor Newsom is making a point that California is a donor state, but I don't think the proposal to actually withhold federal taxes in California could feasibly move forward.
Thank you.
Good morning. Thank you for your presentation. I was tracking in HR 1 charitable contribution deductions, and I know there was a proposed change for corporations and also community foundations. I'm wondering if you can give us an update on, I'm thinking about Wendy's question, and how can we leverage our charitable contributions locally during this time? And so if there's any updates you can give us on HR 1 and if there was any charitable tax changes.
Yeah, I unfortunately don't have that information off the top of my head, but I do know that some foundations, my understanding is you have a certain percentage of your endowment that has to be granted every year, and most foundations, I want to say, just keep it at that percentage, but some, given the unprecedented need that we'll be seeing in the coming years, are going above that requirement to give more funds than what's needed. I'm certainly happy to follow up offline with additional information that I can track down about anything in HR 1 related to charitable giving.
Thank you, Laura.
Thank you.
Thank you, Laura. That was definitely sobering information, but I loved hearing the questions from the crowd and your responses. We're going to make her slide deck available. You can email Michelle Fideli. We'll also be putting it up on our website. It may be sometime in the middle of next week that you'll see that on our website, but please, we'll make sure to get that out to you. It's important information. So the next part of this forum really has to do with looking at how we're going to survive severe budget cuts as organizations, as a community, and I'm really looking forward to the panel conversation today where we're going to be hearing from our local organizations and some local funders, our county departments, and really trying to understand what they're looking at, how they're seeing this, how they're preparing. So if those of you who are on the first panel can make your way up to the stage, that'd be wonderful. Okay, we'll get started. So this panel discussion really has to do with, we're trying to understand our local, how these local cuts are really going to impact us locally. We want to know what cuts are expected, and how will the organizations here anticipate, and agencies anticipate cuts to their organization. Are there gaps that cannot be filled? And so I think we're going to just start with, what do you know? How is this going to look like for your organization? And how are you prioritizing? Does everyone need to take a breath maybe before we start here? I definitely feel like that. I'm going to take a deep breath because it is overwhelming, and I'm definitely holding on to it. So I'm just going to ask everybody, and especially our panelists, because I know there is a lot on your shoulders. Who would like to start? What do you expect? How are you prioritizing?
Good morning, everybody. Before we start, my name is Dr. Lisa Varhus. I'm the Director of Health and Human Services with the County of Marin. Let's, again, thank you, Maria. Let's take a deep breath, because I can't tell you how many gloom and doom conversations that we've been in for the last few months. But I do sit here from a place of hope, and I think as a community it's really important that we really come together around supporting and saving and being in community together in this moment. And thank you. And we actually have a history of this. This community came together during COVID-19. And Marin County had one of the absolute best responses and outcomes from COVID in the entire country. We also know, and we learned through COVID, how we can support and extend our arms around our most vulnerable populations. We know we can do this. It is not that long ago that we did it. And so my request is that we really come together in the spirit of community and diversity and equity and all the things that we actually can continue to protect. So that is sort of our call here as colleagues. And my vision is 4 years from now, 3 years from now, whatever it is, we are doing it. We are still hopeful. We still have community. We are together. In Marin County, we have about 250,000 residents, and of those residents, about 54,000 are enrolled in Medi-Cal currently. And we are also aware that about 11,000 have what is now being called unsatisfactory immigration status. So those are the people that we are going to be putting our arms around going forward. The County of Marin, my department has currently launched a department operations center because of the CalFresh crisis that we now find ourselves in. And my team and other partners are now starting to meet every day at 5 o'clock to figure out how we can address this immediate crisis of CalFresh benefits being paused on November 1st due to the government shutdown. So we are actively working on this together, and we'll be sharing way more information about what is to come. And so I'll stop there and give it to one of my colleagues.
Should we just go along?
Yeah, you can go down the line, yeah.
Okay, thank you. Hello, everyone. My name is Tracy Mendez, and I'm the CEO at Aliados Health. We are a consortium of community health centers that includes, in Marin County, Marin Community Clinics, which Brenda will be speaking, Petaluma Health Center in West Marin, Pedro Toledo's on the next panel, and I don't know if we have the mighty Ritter Center or Marin City Health and Wellness Centers here, but they are other members. So I think in terms of what we know, the impacts to both Medi-Cal and Covered California, Medicare, CalFresh, other programs affecting health centers, the speakers that preceded us this morning, I think covered most of that ground. I think the context I can add for the 50,000+ patients served by the community health centers in Marin annually is just for you all, if you don't know how it works, to understand how those cuts will impact the health centers. So patients are going to continue coming to their health homes. That's what we want them to do. This is where they receive primary care, dental services, behavioral health. Many social services are addressed. Lots of specialty care is coordinated. We have links with many of the community-based organizations that provide social services here. So we want those people to keep coming even if they lose coverage for any of the many reasons you just heard about. And they will no longer have a payer source. They will no longer have coverage. They may start coming to a health center because they had Covered California, but they can't or don't continue to purchase that coverage without the subsidies, or they purchase coverage that's not very good anymore. So the health centers are going to be continuing to see patients and probably bombarded with new uninsured patients. And those patients, instead of us receiving a decent reimbursement from a payer, will be on a sliding fee scale or maybe another program that doesn't pay the health center as well, or that doesn't cover as many services, is more complex to manage. Most of us come from a background where before these great expansions, we had to work with this huge, patchwork quilt of programs. And so it feels a little bit like going back to that. And yet, in the meantime, we've built lots of great programs and services around an expanded coverage, getting closer to having coverage for the population. So this will be very challenging for the health centers. And it's at a time that we know all the folks that lose their CalFresh, that are in fear, that have all the other impacts that the administration is having, are going to be more distressed, have more emotional challenges, bring all that to the health center, more paperwork, administrative complexities, not just around the coverage, but also around vaccines, that now they need a provider letter to confirm they can get a COVID vaccine instead of us just vaccinating them. So the workload's higher, the payment is less, and we're gonna try and keep doing everything we can for the population, but it will be that much harder. And that's hard on our workforce. It's already hard working in a community health center. If you don't know that, people are very driven by the mission, and it's gonna make it really hard to keep working in that under-resourced setting. So I think that's what I'll lead with.
I'll say morning. I won't say good morning. We've had a lot of news today. I'm Brenda Shipp. I'm the CEO for Marin Community Clinic. We served about 40,000 patients last year, converted into around 242 visits, and 5% of that was probably undocumented. I had a lot of things on my mind until I listened to all the presentations today, and as I was listening, a story started to develop in my mind about what this really means, and I put a family before me. What is the impact on the entire family? And so when we talk about family and how and who this is impacting, I'm asking you to imagine, let's start with our children. The SNAP, right? There are going to be so many reductions in food, and so the food that's nutritious they will not be able to get, which means that there are probably going to be very young children going to school hungry. And that is the family, right? That's the child. And then we go up to the moms. Someone did a presentation about the income that moms receive, and we're getting reductions in child care. And so are they going to be able to work if the child care is so expensive they cannot afford it? Let's add in a family member who may be disabled, who needs someone there to take care of them. And now they can't do that because of all of the different things that are going to be cut. We think of extended families and the seniors who can be in those homes with them and the cuts that are going to happen. I don't call this HR 1. Some of you have heard me say I call it a storm because it is the total destruction of families. It's not a destruction of a person, it's the destruction of families because the way our structure is set up, so many of us have extended households. We are caregivers, we're moms, we have children. Everyone is being impacted. Community health centers, our mission at Marin Community is to provide excellent, compassionate care to all. That is being challenged because of all of the reductions and all of the cuts that are going to happen. But yet we're still going to do the work. I want to be clear. We're going to do that work because that's what community health centers do. And so I'll go with what Dr. Ward, who says we have to do this together. We cannot do it as one entity, and I know sometimes we think we can, but we cannot. And so I think more than ever we have to align together to keep our democracy as it is, but more importantly, how do we protect our families? Think about the family and every single person that will be impacted, whether they're in your household or not. And so what we're looking at right now is how do we do that? How do we not leave anyone behind? Not leave a child, not leave an adult, not leave a disabled, not leave a senior. What do we have to put in place to make sure that we can do our mission in the way it was intended to be done? And I will stop here and pass it on.
Hi, everyone. I'm Lisa Miller. I'm Assistant Superintendent at the Marin County Office of Education, so I'm here to represent the public education sector, and I'm so grateful to be up here with our counterparts because it really does take all of us working together, and I just want to especially appreciate the gesture of the clinics will serve anybody even without reimbursement or any payment. I think that's incredibly benevolent. So I'm honored to be up here with you. From the public education sector, I'm going to speak specifically to one part of where we have faced immediate federal cuts when this new administration came in, and then I'll speak very briefly of how schools are impacted by this broader picture we've been hearing about, where children may be facing hunger, families will be facing hunger, among other things. The first is, public schools really have become the hub for wellness for youth. That has been really evolving over some time, but particularly in the last decade, and then COVID just put that on steroids. One of the parts of youth health and wellness is obviously their mental health. Currently, there is no legislative funding to hire staff in schools to provide the essential mental health services for youth. However, we know it's imperative that we do that. So we at MCOE partnered with some of our school districts, applied for a federal grant specifically to pay for mental health services in schools. We were awarded that grant for approximately $15 million. And that grant started on January 1, 2025. And it was to carry us through 2029. It was going to, again, pay for mental health service providers in our schools. Unfortunately, in April 2025, we got a letter from the federal government telling us that that grant has been ended because this administration has different priorities. That is more than a gut punch. These are actual people in our schools serving our students. We're all aware of the mental health crisis with our youth. That data continues to just be demonstrated almost in weekly articles, social media, early, underage pregnancies or early pregnancies, just human trafficking, you name it, the things our children are facing. So to lose that money has been really consequential. One thing we're trying to do about it is we did join a lawsuit with our Attorney General, along with 16 other states' Attorney Generals, to file against the Trump administration and seek an injunction on the cancellation of the grants. That has already gone to hearing. The federal lawyer did ask the judge, the hearing was in Washington State. The federal government did ask for the filing to be dismissed. This week, that judge denied the federal government's request to dismiss that filing, which is awesome, yes. And we are hoping to hear soon from the judge of whether or not we will get an injunction. This is, might seem small when you hear the number $14.5 million, but to a school setting, public schools in particular, where we really relied on a lot of the one-time dollars of COVID funds to help build up our wellness centers and our mental health staff, and those funds have sunset. This funding is essential. I will just also say that as we hear about the cuts that are going to be facing of having our families and youth insured, access to vaccines, access to food, there's no question this doesn't show up in our schools. How children access their education, engage in that environment is completely tied to their well-being. So we're here on behalf of the public education sector to say we're partnering with you in any way we can to keep having our families and youth served in Marin County. Thank you.
Morning. Tanis Crosby, she, hers. I serve as Executive Director of San Francisco Marin Food Bank. Maria, thank you for bringing us together. And thanks to each and all of you for making time at this moment to be together, to discuss, and to hopefully walk away with that action plan. And I also just want to say thank you to our county leaders, because what's really special about Marin is that we have leaders who directly communicate with community, who see this as a system, and not only look at the short term, but the long term, and I appreciate how you lead. Thank you. So before talking about HR 1, let's go back just a little bit, because before July 4th, did you know that federal HHS eliminated the office that calculates the poverty rates? So there are no longer staff who calculate poverty levels in this country. So we eliminated that office, then gutted SNAP, and just a couple of weeks ago, the function that calculated levels of food insecurity in this nation has gone away. So this is a coordinated effort to erase levels of poverty with no data and with no insight. So I just want to be very clear about what we're dealing with here, which is the erasure of our reality that we see in our communities. And we will not let that stand. When it comes to SNAP, this is our country's most effective anti-poverty, anti-hunger program. We will not food bank our way out of this. We will not. We cannot. Because this is about poverty and racism. This is not about more food. You saw the chart that showed that at the height of the pandemic, we reduced poverty. That was because of policy measures. That was because the child tax credit was deployed. What I am holding on to in terms of hope is not just growing that pie, but maybe we need a cake or a fruit salad, okay? When we are thinking about SNAP and CalFresh, what I'm holding on to is not restoring the cuts, but having something entirely different that delivers income supplements to people who are low income without an application. So, briefly, let's look at some of the facts around SNAP to get us excited about policy change. Are you with me? Okay.
Yes.
So, this is not a criticism of the state. Let's just look at the facts. California, before HR 1, had among the lowest performing enrollment of SNAP in the nation. We were always in the bottom 10. There are states like Texas and Mississippi that have higher enrollment than California. Did you know this? So we were always around 70% enrollment and participation in SNAP in California. It's a complicated program. Have you applied for CalFresh? It is very hard. And then our hardworking county eligibility workers need to look at this is a very complicated program. Whenever we have programs designed for problems that have restrictions and eligibility, it is expensive to administer. And this is not just because I'm from Canada, like Cheryl, originally. I'm now a proud citizen. But whenever we have programs that are bespoke for a problem, it takes a lot to administer. Universal programs that are based on information we already have, like income, like the child tax credit, are a lot easier to administer at scale. Okay. So CalFresh, we were lowest performing in the nation, but here's where we were top. Program administration costs. So let's just rewrite this. Let's look at ways that we can deliver more money to more people at scale, more effectively, so that people can buy food and cover basic necessities. Because the reality was, before July 4th, there were 2.7 million people in California who weren't accessing $3.5 billion in benefits to which they were entitled. And 3 out of every 5 older adults, 3 out of every 5 older adults in California weren't getting CalFresh benefits in the first place. This is unacceptable. So going forward, we need to not show up at a tsunami with sandbags. We need to all move our state to higher ground and protect people who are poor and people who are not citizens in this state. We are the 4th largest economy in the world. We are the 4th largest economy in the world. We can feed our people, we can take care of the health of our people, we can choose something different. The burden should not be on the social safety net. We are and must be the shield, not the net, but our county can't bear all the burden, and our state does make the rules, and we can make different choices about our money. I'll end there with this. There was a data point in this presentation about food banks getting more money in the state government, a budget. We did. $20 million across the whole state. San Francisco Marin Food Bank will have enough money to buy eggs for 5 weeks. That's what that was. So this is not enough, okay? We need bold, big policy change at the state level, and let's walk away with the fortitude to make bold policy change happen, because our community is relying on us, and we can't food bank our way out of this.
I think I want to sing "Oh Canada" right now. My name is Cheryl Paddock. I'm the CEO of North Marin Community Services and a partner of everyone here on this stage. And I'm thinking back to when I started in this role. It was the Great Recession in 2008. And so I'm just nearing my 17th year in this role. So I've seen a lot of chapters of policy change and funding changes. And I was deeply thinking during the two presentations today, in addition to crying, in that what can we do to co-design, taking all the information we have now to rewriting our next chapter. And I think back to when we reduced underage drinking. We've solved a lot. Teen pregnancy prevention numbers went down. We've closed programs because we've solved public health issues. So I'm thinking about what can we do as a county to rally our resources. We just do better when we align our strategic plans within nonprofits, within cities, within counties, within states. And so I would like, my call to action would be that we all rewrite the direction that we're going so that we're all walking in the same direction and using our resources as effectively as possible. For us at North Marin Community Services, we have a budget right now of $10 million. 40% is government funding. We know that we're going to lose at least over $1 million in the spring, and all of that is for bilingual services, mental health services, newcomer services, the Promotores program. And we're fortunate in that we have a lot of local donors. We have family funds, we have foundations, and so we're really going to be calling upon those people to invest in the resources that we have. And what I'm seeing is that a lot of foundations are making multi-year commitments when they know we're working in partnership with each other. They don't want us to be working in silos. And so I'm loving that our partners from West Marin are here, Marin City, Canal, Novato, those are the hubs, San Francisco. And so how can we come together, realign, best use our resources, because we know we're going to have to close programs. We know we're going to have to lay off some staff. In 2008, when I started, that's what I had to do. And in fact, our deputy director, our former Elena Cantor is here, who's now at the county and has a new role. And also, I want to name my partner, my CFO of 16 years, Benshika Nachnani. Without the dedication and the trusted partnerships, we can't do this work. And the other piece, I don't know if we're going to get to that closing statement, but I just want to say, as employers, we have a responsibility to provide psychological safety to our staff, our volunteers, and those we serve, and that's also going to take work from each of us. And so coming together to rewrite what does psychological safety look like in this unknown perfect storm environment where needs are high and funding is reduced. So we're going to have to do this together. Thank you.
Good morning. I'm Chandra Alexander, and I'm the CEO of Community Action Marin. We've been around for just about 60 years and have weathered a few storms, but I want to say that part of what I think we're really proud of is being able to be in relationship with trusted partners like all of you here and in this audience, because we do know, I think has been really well said already, that none of what we're facing today is going to be solved with any one of us alone. And any challenge to any one program, given a federal funding cut, is going to be remedied in isolation. And so I am really, really proud that we're able to have a call to action, be fiscally mindful, thoughtful, innovative, and creative to call upon the entire community. But in addition to that awareness, I think it really is the ability of each and every one of us to, as I think so many here have already said, take that responsibility to leverage the power of our voice, our phone calls, our action, because I do think that is what, at the end of the day, will make a difference. For Community Action Marin, we have about $7 million in direct federal funding, and we have another $17 or $18 million more in other government sources. And part of the power of and challenge of what we're looking at right now is that in order to be able to pay our staff an increasing livable wage, which we've been able to do over the past 5 years, increasing every year by 10% to pay our people more, the frontline workers providing the services, helping to hold up that safety net, is because we've been able to braid and blend our federal funding with other dollars. We know that that is a key resource to be able to continue to provide what's needed, but the challenge is that when you start to look at funding cuts, you're not talking only about the direct services that are being provided. So for example, federal dollars at Community Action Marin help to support high quality early education with Head Start. We braid and blend that funding with our state funding, with local funding to provide increased quality and services to more children and more families. We also help to support the low-income home energy assistance program. We're keeping lights on, we're keeping families and individuals warm and safe in their homes. But importantly, a lot of that federal funding is, again, combined to support essential core capacity for organizations, how we do across our community with our trusted partners, how we do intake, how we help to track data, how we help to support individuals and families across a continuum from crisis into stability and on to thriving. All of that work is possible because we're able to be thoughtful, efficient, and creative in the leverage of the government dollars that we have. And so a real threat to our community is those dollars going away and the ability that we want to continue to have to be able to best support and use data and get resources to individuals and families and the community. So we know that we all lose, but I think the call to action is clear that the individual choices that we're making within our community and the ways in which we're working together and coming to the table together is going to make the difference for all of us and for those we serve in our community. Thank you.
Thank you. You answered several of the questions that I already had and I appreciate it, very efficient. And we have some time. I'm curious, Lisa, Dr. Warhouse talked about how she has started a 5 p.m. meeting sort of to debrief the day and internally, organizationally, sort of strategizing and doing some planning at that 5 o'clock meeting. I'm curious if there's some internal sort of planning and work that you're doing that you'd like to lift and elevate that we can learn from around these cuts. Mm-hmm. Whoever wants to go. Lisa talked about the 5 p.m. meeting. Is there other things that you've been doing? Yeah.
I'll share two things. One is feeding off of something I think Laura mentioned earlier. Obviously, it's a big priority for all of us to make sure everybody who is eligible for Medi-Cal, Covered California, CalFresh, or any other public benefit gets on and keeps that benefit. So at my organization, we've helped organize our health centers and other partners with weekly meetings around how can we get out the word in community in various places, make sure people who are eligible now but won't be eligible after January 1st, enroll in Medi-Cal, educate them about the changes happening, et cetera. So we're doing lots around that, and I know everybody is. That's obviously huge. And then the other thing we've done as an organization that I think has been valuable is the CEOs of the health centers that we work with. We meet either weekly or every other week for a morning meeting just to process and get the word out about all the changes that are happening in our health world and the adjacent worlds all the time. It feels like the biggest risk sometimes is just the chaos and uncertainty. And if you're a Brenda or a Pedro or any of the rest of you, suddenly you're being asked to sign grant attestations that say you will comply with every single executive order that's ever been issued, which are out of compliance with state law. Sometimes you're asked, the things that come at us are constant. And then our staff turn to us, right, and want guidance and want support, and we don't feel supported. So I think that's been really helpful for us as a network.
That's great.
I can add one thing. We are strengthening fiscal awareness across our entire agency with all levels of staff, and that means helping our leadership and managers really understand their budgets, really understand the inflows and the outflows, having budget to actual conversations, forecasting conversations, engaging with our board to be very, very thoughtful about contingencies and doing the planning, scenario planning that's going to be really required, but we're doing it way in advance of when we might normally start the process. We're having conversations a year in advance, and we're really coming up with the hopeful situations, and we're coming up with the what-if situations that we may not like to think about, but it's really helping us get creative. And because we're doing the harder work of looking at and educating our staff around finances, they're coming up with creative solutions too. So really being aware that even though sometimes looking at the numbers may be off-putting or hard, it's an incredibly important part of the responsibility I think we have as leaders today.
Yeah, I think Brenda has her hand up. Oh, would you like to?
So at Marin Community Clinics, we're looking at how we can make sure that we are talking to our patients at every touch point. You know, that's something we didn't do, but now we're wanting to make sure at every touch point, whether it's calling in to the call center, the front desk, medical assistants, everyone, reminding people that these changes are coming, letting them know that we are there to help them, educating, creating more enrollment staff, because that's going to be a huge, huge need. Now we're going from a year to 6 months and all the different things that come. And so we're not waiting for that. We're making sure if a patient calls in, remind them. Eligibility is changing. Do you need assistance? What does that look like? And preparing to do that. Outreaching to those patients who may not have been coming in the way they should and reminding them of the importance of coming in reach. All of the things that we need to make sure we're not forgetting is done. Same as Chandra just said, educating our staff on the importance and understanding what all of this means, because it's very confusing to understand what all of this means. Tanis mentioned the food bank. Last year, through volunteer services, we distributed 1 million pounds of food.
Woo!
That is a lot.
Yes.
To distribute. And we can only do that through partnership. And the reason I mention that is because if we did 1 million pounds last year in the situation, what is next year going to look like? And what is next year going to require? And that $20 billion of 5 eggs for that many weeks is not going to do it. This week we had 9,000 pounds of food and people were there to get it. So people are desperately in need. People are having challenges. Marin is a beautiful place, but it is an expensive place. And we have a lot of people here in need. And so we're making sure that we're covering our mission, not only just to provide physical care, we're also there as community. Like, that's what community health means. What resources can we provide to the community? How can we partner and make sure that we're not duplicating, but recreating and adding more to provide services? So we're committed to doing that. And I think it's just education. And all of us, all of you, can help to do that by educating friends, neighbors, families about what's coming, because the news is overwhelming and it becomes very, I think, disheartening. And sometimes we stop looking. So we really have to work together on that.
Brenda, before you pass it on, I just want a little follow-up question for you. There's something you said to me in a conversation, and I think it's important to elevate here as well. Is you talked about that we think this is happening to other people.
Yes.
How do you see this impacting all of us here in this room?
Thank you for the reminder.
Yeah.
So many people think this is only impacting undocumented people, people who might be ineligible, but this is not true. This is impacting every single person in every single county. We're all going to lose resources. Our emergency rooms are going to fill in. Our kids are going to not be learning as much as they need to learn in school. Behavior challenges are going to happen because kids are going to school hungry. There are parents who are upset. They don't know what to do. How are they going to manage? They have no resource. So this is not just impacting people who are undocumented or people who are underserved. This is impacting the community. The ERs are going to fill up because there's an expectation. I don't now have coverage. I'm really sick. Where am I going to go? I'm going to go to the emergency room. And at Marin, we fought very hard to stop those visits to the ER because we want people to come to their primary cares. And I think all of the community health centers have worked hard to say, come to your PCP. After ACA, we did really well on getting people to really adhere to coming to their PCP, but guess what? This week, people are getting afraid again. People are already calling us not wanting to come in to the clinic because ICE is out. Remember the notice we said, oh, they're going to San Francisco, Oakland, Alameda? Well, guess what? They're in Nevada. And so people are already calling saying we don't want to come in. So this is a community issue. It's not a bad or not. It's a community issue.
And I just want to add to that because we that work, so all of us sort of dedicated public service to community, to those most vulnerable, are so often working together kind of on our own to solve the issue. It's a community issue. We also need to get better in bringing in the community to help solve the problem. Citizens of this county want to support. They need to know how. We need to figure out how to draw them in. This is still a wealthy county. Raise your hand here if in the last week you've thrown out food. We can solve this together.
And I can take us back to the original question. And thank you, Brenda. Sorry, that was also off script, but I thought it was important to lift. The original question is, how are you organizing internally around these issues? What are you doing? What systems are you putting in place?
So how the food bank is organizing internally is getting ready to talk to you all, our partners, to invite partnership, to ask, can you serve another 50? Can you serve another 350? Will you take another truckload? How we're organizing internally is shoring up our supply chain with local farmers. We're not depending on USDA, okay? Let's be very clear. And we also said, no thank you, National Guard. We got this. So that's how we're organizing internally.
You always have such a good ending, and then I have to follow you. I want to say that what we've done at North Marin Community Services is we've collapsed our 3-year plans because everything is just so unpredictable right now. So we've gone to annual plans. Yesterday we had a leadership retreat. We collapsed a whole bunch of goals because we don't need stretch goals this year. We already have stretch goals at the federal level. And so let's make it easy on ourselves so that we can feel successful in the work that we know that we have, that we can do. In addition, I'm just going to dovetail off of the ICE conversation. We've done a lot of work with the Marin Prevention Network, the Rapid Response. I want to name the Continuum of Care partnerships, and we're on many by name lists because we know that the most vulnerable people are being served by all of our organizations. So how are we making sure that these families are receiving wraparound services so that they can stay housed, stay fed, stay in school, stay in their jobs? And so the more that you can each promote your staff to be in these circles, in the collaborative conversations, and the by name list, the better. And I don't know if Gary Nadja-Reese is still here, but thank you for all that you do for the county because there's so much good work happening. And then let's not do the work that is not in service of what we do. And that's what we were doing yesterday with our leadership team, is like, let's drop that matrix, let's drop that procedure because we need to march in this direction.
Something I want to add from the public education space on, some work we're trying to do to increase some revenue to maintain wellness staff in schools is, and I'm going to really try and avoid a lot of acronyms here and abbreviations, but and be succinct. We are lucky to live in California for many reasons, and this new one, which I don't know how many of you are familiar with, in 2022, Governor Newsom signed some revolutionary legislation called the Children and Youth Behavioral Health Initiative, CYBHI. And this initiative said the health industry and the public school industry need to start working together so that public schools can bill insurance for general ed, mental health, and wellness services at schools. That is not happening in any other state in the country. As I said before, schools really have become the place where wellness services are delivered, not for everybody, and we honor and respect that that may not be the place for every family. We certainly don't force it upon anybody. yet the volume is high, the demand is high, and we need staff there to be responsive. So one of the things we're working on with our school districts is to develop the practices and work with the staff to learn that really unfortunate skill that many of us have of how to bill insurance. And we're talking private insurance too. This is not only Medi-Cal, this is your Kaiser, your Blue Shield, your Aetna, where they have now a legal mandate to reimburse schools who submit bills for eligible services provided to youth, because that's where most youth are getting the services. So that's one thing we're continuing to work on. I think most of us up here know that is two industries that couldn't be deeper in bureaucracy. And to try to get them to get along and have two big laws, FERPA and HIPAA, also sync up is tough. So it's a long road, but it is something we're working on to try to fill some of this gap.
Thank you. Thank you. I think we have an incredible opportunity to talk to leaders in our community that are really thinking about this internally and also systemically and working together. So I wanted to, if it's okay with the group, to open up to some questions from the audience. Does anyone have a question that they would like to ask? And if so, if you could walk to the mic. I know it's far, I apologize. Thank you, great.
Good morning. My name is Alana Garcia, and I'm actually a staff member at Community Action Marin. Hi, Chandra. I had a question. I wanted to know how can, apart from working at Community Action Marin, how can I, as a citizen working in Marin, how can I be a part of policy change or getting involved with some of these individuals that are on stage?
I'll jump in on that. I'll take advantage of that opportunity. So as the initiative I just shared about, the Children, Youth, and Behavioral Health Initiative, we really need to be able to effectively communicate with our parents and our families what that means. We cannot submit bills without consent, nor should we. And that might be a really frightening thought, that I'm going to give my child's school their health insurance, and then they're going to bill my health insurance, but is my copay going to go up? Am I going to have to pay a deductible? Is my overall, premium going to go up? And none of that is going to go up. There is no copay, there is no deductible for it, nothing, and you get to still get the same service privately. It does not change what you get if you get this service. So engagement with our community and families to help the broader community understand the initiative is something that we're looking for partners on, because we want families to be able to hear it not just from the school setting, but from our clinics and elsewhere, because it will take so many inroads of communication from the trusting sector that our families go to. That's one thing that comes up for me.
Great, thank you.
I would answer that there's dozens of collaboratives in Marin County, and so really thinking about what's your affinity area. Is it food? Is it housing? Is it workforce development? And then ask Chandra which collaborative you should join.
No pressure, Chandra.
More conversation, Alana, but the one thing that I would add is I think we need to continue getting people registered to vote. So anything that we can do in our community to engage more individuals in that process would be really, really helpful.
Thank you. Next.
Hi, my name is Pat Eklund, and I have the honor of serving on the Novato City Council. And I first wanted to thank the organizers of this forum. This is fantastic. You have done an outstanding job at really focusing on a lot of issues that I think cities and Marin need to be more engaged in, and I'd like to help you to help facilitate that. That's number one. So I'm going to give you my contact information.
Thank you.
I am, as a lot of folks up there know, my mom is 98 years old, and I was raised in Marin County, so I haven't really moved very far, Novato, from Terra Linda. But anyway, so we have a lot of seniors in Marin County, and my mother has a good friend that has no income. And so we help her personally. But I know that there's more that are living in a house that are by themselves, that don't have kids. And so what can we do to help the seniors that don't have enough food in their house or don't have the money to be able to even pay the copay for their medical services, which is something that we're helping my mom's friend with. But I know that there's a lot of others. So you've talked a lot about school kids and stuff like that, but I'm really worried about the senior population. That is the really silent population in our county that needs some help. If you could help me address that, and I'd love to help in any way I can to help get the word out. So anyway.
Thank you.
So thank you very much. Great forum, and I just want to thank all of you for coming. But please talk to your local council member, mayor, or whatever, because we all care. And I'd like to help you to facilitate that. So
Thank you.
Thank you.
Pat. Brenda, you want to go?
Thank
and then
you for
Chandra.
that question. That actually is one of the topics at Marin Community Clinics right now is our seniors and what we can do to be more proactive and more attentive to seniors and what might that look like. So we are talking about, because one of the things, my history, not to take a long time, but my history in community health started with me working with seniors when I was in Berkeley, and so I have a real passion for what and how that looks like, because there are special people and they need special ways to be taken care of, and it's not our normal come in 15-minute in and out the door. And so we're talking about how we might develop an area in our clinic that's specific to seniors and partnering with some other organizations that have some wraparound services for seniors. I'm interested in a one-stop shop where a senior can come in, medical care, behavioral health, and some specialty services. So it is at the top of our list. We have a meeting next week to talk about how we might start that at Marin Clinic, so we will keep people posted around what that looks like. But it is at the top of our priority list as we're looking at what things we can do, because there are a lot of aging people in Marin County, and we will need help, Councilwoman, on what that looks like. So thank you for that very much.
Thank you.
Thanks,
Chandra.
Pat. Yeah, so we're supposed to have lunch, so that's number one. And number two, many of us are really interested in working with the city of Novato to help support tenant protections. And the reason I'm bringing that up is because we know that we have people aging into poverty, people who are house rich but cash poor. You're talking about some of that. Our demographics are changing. People can't afford medications and rent. Things like that are really shifting the nature of our community. North Marin Community Services, Community Action Marin, Legal Aid of Marin, we're all really wanting to work with the city to help support tenant protections in our community and think that you could be an incredible champion. So we look forward to continuing that conversation.
Who's next?
Could I quickly just
thank you,
jump in?
Yeah.
Please go to sfmfoodbank.org. There's a click Find Food and get connected with one of my colleagues. We have a team that speaks 7 different languages, but for this older adult who needs food, please call. We have a home delivered grocery program that reaches 6,000 people who are older adults or persons with disabilities who aren't able to physically go to a pantry. I want to be really clear, there's a wait list right now. However, we're working to secure additional resources so we can serve more people. But older adults in Marin do receive weekly home delivered groceries. It's like 26 pounds. There's always a protein, a grain, 70% fresh fruits and vegetables. It is a lot of food, and it is good food. So please reach out, sfmfoodbank.org, click Find Food, fill out the information, and also say, I want to ensure I am eligible for CalFresh, and our folks can help get signed up. Again, 3 out of 5 adults, older adults in California are eligible but not signed up. So let's make sure if they are eligible for CalFresh that they get it.
Great. We're going to be sharing the links as well that were just shared, so with the group and in the email that Michelle is going to send out. So thank you. Yes. Next question.
Hola, muy buenos días. Mi nombre es Verónica Duarte. Vengo de la organización PIA, que están ubicados en Marin, Chalconso, y soy madre de 5 niños, todos menores de 14 años.
I'll be translating.
Thank you.
I'll try. Good morning. My name is Veronica, and I'm from parent group PIA from Marin Chauker Council, and I am a mother of 5 kids.
Estoy aquí primero para darle las gracias al grupo. Si todos han notado, el grupo que está enfrente de nosotros, todas son mujeres.
First of all, I want to say thank you to all of us in here for being in here, and for the panel in front of us, that if we can see, they're all women, wonderful women. And
No tengo nada en contra del liderazgo de hombres porque soy mamá de 4 niños varones.
I'm not against any male leadership, but because I am a mother of 4 young boys.
Lo que les quiero decir que muchas gracias. Sé que ustedes van a hacer que el poco presupuesto que tienen nos alcance para tanto como para ancianos, para niños, para personas indocumentadas, para personas con papeles. Yo sé que va a alcanzar para todos.
She said that she's thankful for you guys being in there and having the wisdom to work with the budget that you guys working now, because you're gonna have the wisdom to strengthen that money to help childcare, to help elderlies, to help undocumented and documented people too. You will have the wisdom to know how to stretch that money.
Ahorita también ya me veo afectada. Mi bebé no tiene cuidado de niño, pero sigo luchando porque sé que el poco presupuesto que tenemos nos va a alcanzar para las familias que están enroladas ahorita.
I want to say that I am already being affected with the budget cut and all that, because I am currently not available to have a childcare spot. But she says she's continued to fight and with all the organizations, because she knows that eventually one day those funds will be available.
Pero también quiero agradecer a la mayoría de personas, porque la mayoría de ustedes que están aquí, la mayoría son personas ciudadanas americanas, y les quiero agradecer por el apoyo que nos dan a nuestra comunidad latina.
And she wants to say thank you to all of you and that are in here, because she's sure that everyone is documented and legal. And she said that what else? I forgot. ¿Qué dijo el último?
Que a pesar de que ellos nos apoyan a toda la comunidad latina.
Because she knows that you guys support all that undocumented community.
Así que muchas gracias, y sé que ustedes van a tener la sabiduría para guiarnos a todos, porque son varios que estamos detrás de ustedes.
And thank you, because you guys will have the wisdom to guide us, because she knows there is a lot of us behind you guys. That's it.
Muchas gracias.
Good morning. Rachel Kurtz, council member for City of San Rafael. Thank you all for being here. One of the silver linings that came from the pandemic was the county's response around standing up the CRTs, the community resilience teams. And I'm wondering if you're using that model to further in this time. So that's one question. Second one is around the older adults in Marin. And if right now the community resilience teams do look across the board, but I was wondering if there could be some additional focus specifically around older adults with the community, with the CRTs.
So thank you for that question, Councilmember Kurtz. So just for context, during the pandemic, there's a lot of educated, highly functional, highly, wealthier folks in Marin who read the science, listened to, different experts around COVID and followed, the distancing and the hand washing, and were able to isolate or be in their homes. And when vaccinations became available, we were able to stand up a mass vax clinic, and people showed up in droves. Like, do you remember like trying to press enter on your computer to get that appointment? Yeah, so I was doing that for my husband, like, however, we were more concerned about our vulnerable communities who may not have access to the same information for good reasons, don't necessarily trust the medical profession or medical expertise due to historical racist practices, and who we knew had the higher risks of serious outcomes from COVID. And so we started these, what we're now calling community resiliency teams, in sort of lower barrier neighborhoods. And we worked with our nonprofit communities to stand up these teams that really, household by household, church by church, got the information out, got people tested, supported vaccination, met people where they were at instead of telling them what to do. And really, through really strong cultural responsive practices, were able to really protect communities that were at highest risk, and they did so very effectively. I was not here at the time. I was in a similar community doing similar things, though, and that was our focus, like, how do we protect our most vulnerable? That was an incredibly successful effort that we have now continued into broadening, sort of broader both emergency preparedness, public health, and social service awareness and supports, again, meeting community members where they're at to get them critical resources, information, services, and that kind of thing. People don't trust government right now. I am highly aware that I work for government. So I might be a nice person, and I might think that I'm, relatable, but a lot of other people disagree, and I know that. So therefore, we intentionally work with trusted partners, our nonprofits, our community members, volunteers, give them, support them. The Board of Supervisors allocates resources to them to do that work. So we're expanding that. So we're continuing that work. So we have a fifth team. So we have community resiliency teams in North Marin, in Southern Marin, in West Marin, Novato, the Canal,
San Rafael.
and San Rafael.
No,
That might be the Canal one.
Central Marin.
Central Marin. We have a new one in Central Marin that's just forming.
Great.
So we're going to continue to rely on those teams in this work. In fact, at our 5 o'clock meeting last night, we talked about how can we, work with the community resiliency teams to get the information out to folks. So that's one thing. Two, we do have an aging population in Marin. There are estimates that in the next, 5 to 10 years will be 40% people over the age of 50. And we also know that as people age, and we are living longer, and Marin County has a very high life expectancy rate, people, bump into isolation. They are in fixed incomes. They do need additional supports and services. I will say that about 40% of Health and Human Services resources actually goes to people over 50 because they are eligible for those services and supports. And that's a critical population. We do in the county, in our administration and planning department, we've hired a new analyst who is really helping us to look at the data around the senior population and giving guidance and support to the Commission on Aging and other critical partners so that we can really have a much more streamlined strategy around older adults and seniors and really understand our impacts and what we need to do to better support that community. So that's one place where we're also doing that work.
Thank you.
I'm just going to add, hi Rachel, nice to see you. So we're the North Marin Community Services is the lead organization for the NCRT, which is in Novato. And I would say in answer to your question, actually engaging Vivalon and other partners who directly serve aging adults to be part of the CRTs, because as Amy was explaining, there's been a shift. You know, it was the vaccination, now it's basic needs. And I don't know, for instance, at NCRT, I don't think we have an organization that represents aging adults. I mean, we all serve aging adults, but that's not our primary focus. And what we know at North Marin is that we have more seniors entering poverty and homelessness for the first time in their lives. So it's definitely a priority that we need to pay attention to and realign our resources around.
Thank you. And just as a final comment, and then I'll hand it off, is one of the other values I saw with the CRT was the reduction of duplication of effort within the groups. And I think that as we're going into this situation I consider a crisis right now, all of our agencies and civic service agencies need to make sure we're not doing a duplication of effort across the board. So thank you.
Thank you. We are running a little short on time, so if we can make it as quick as possible. We have like 5 to 6 minutes, honestly.
I will.
Yes, thank you.
Hi, good morning. I'm Hilda Castillo from Maternidad y Esperanza program, Bocalu program. I work with Latino families, and I am aware of what is happening to our families. As you know very well, we are going through very difficult time in our life. And our family, Latino families, are one of the most affected. Not only because their legal status, they can be legally here or not, but we all are affected. I consider myself an immigrant, so I am affected as well. My concern is that, and I would like to know how this situation with immigration, rental assistance going up, paying or getting the daily food that they need at the table is affecting children at school, for example. And I am aware that many of the moms that come to my program are suffering right now from depression because everything that is happening around the Latino family. How is this affecting the family with depression? I would like to know if you have seen an increase Latino individuals affected by depression because all of what is happening. Thank you. And I want to thank the mother that spoke before me. Thank you for this, for putting together this program for 5. Thank you.
I'm happy to respond on the education part, and I appreciate the question. So we, again, you know, the partnerships in Marin, I just can't say enough about. As it relates to immigration and immigration enforcement in schools, as soon as this new administration won the election, we rolled out trainings to all of the schools in Marin, including our private and parochial schools, to make sure that all staff knew what the students' and families' rights were to access their education. And that training included what are the limitations for if ICE does come to a public school campus. They don't have full access to the campus, so we wanted to make sure school staff understood that. And in fact, Newsom just signed 2 additional legislations to reinforce that schools actually are safe places for families and students, and if there's a confirmed immigration presence on a campus, we are required to immediately send an email to all families and students and staff so that families can make a decision that's best for them and their families, knowing that there's been confirmed ICE in the area. We are constantly doing communication, outreach, and continuing to educate school staff so that we are prepared. We do look to our partners for that messaging to our families that schools do continue to be safe places for families and students. We recognize that may not feel like it, though, especially during this climate. We work closely with rapid response, definitely monitoring the presence of ICE, and as soon as we get information, we send it out to all of our school sites. I do want to give a shout out to school staff that are in roles, many are, the job title is community liaison. They do the lion's share of this work with our families to help bridge the trust gap and potentially the communication gap that schools are safe places. And we are seeing it. We see it. Families will not send their children to schools when there are reports that ICE might be nearby or might be showing up. The fear is real. We see it. That disruption, as we can all anticipate, has a ripple effect. The stress of the child the next time they come to school, will their family be there when they go home from school? So the overall kind of psychological trauma this causes definitely plays out in our schools. And I would like to say and think that our schools have a really compassionate stance on this in Marin, in serving our students and families that are experiencing this.
Thank you. Thank you.
Yeah, I will say that quickly, yes, and I think many on the panel have already spoken to the importance of really bringing the community in and providing safe spaces for conversations and connection. Just last night, for example, we had our board of directors meeting, and in the meeting, we welcomed our Parent Leadership Council from the community. And I can share with you that we noted the challenges of families not wanting to go into the childcare setting or not wanting to go out of the home for socialization visits. And we've adapted how we work to ensure that we can still be in connection and relationship with families. But I will share with you, going back to that initial note of hopefulness, that after the meeting and the conversation and the time together and the fun and the food and the sharing with our parents in our community, that we went around and we each shared a word, and I can tell you that from the parent perspective, from the community perspective, there was hope, there was energy, there was excitement because we had taken the time to say they mattered. And I think we need to continue to double down on making that effort and put intentionality into engaging with everyone in our community.
Oof. Thank you. Yeah.
Hi, good morning, everyone. My name is Maria Pech. I am a member of Parent Voices, but today I want to thank everyone as a community member. Okay, so these words are not from Parent Voices, but as a community member. I really thank you, everyone, to tell us how these cuts are going to affect everyone. I really appreciate the time. As a mom, I have fear, I have problems. I know that too many families in the community are dealing how to provide the food. We know we have problems with the buildings for the housing, right? Now we have this fear of more agents coming to our beautiful Bay Area. So we really need to get together. We need to forget the limits of every organizations, get together because a community outside, it's waiting for us. And we have to get together. Thank you.
Beautiful. Thank you.
Yeah, hi, my name is Connie Barker. I live in Novato. I'm a member of the Health Council of Marin, and I'm a member organizer with SEIU 2015, which represents the IHSS workers. There's two things, this is a really quick question or observation. There's two things I haven't heard a lot about so far. IHSS is funded through Medi-Cal/Medicaid. Haven't heard anything about it, if there are impending cuts to that. And the second thing is Section 8 housing choice vouchers and project-based Section 8 subsidies. These are both things that will really affect the people I take care of and the people in my life. So are there things with the shutdown or that are on, that we could be expecting in like the first half of next year about those two programs?
Yeah, so hi, and I see Dario is here from the Public Authority representing IHSS as well. If people lose their Medi-Cal benefit, they will lose their IHSS benefit. The concern, I will say that with the state, one of the major state cuts in response to the state budget has been to not be able to provide IHSS benefits to undocumented Medi-Cal recipients, which is really unfortunate and obviously puts people at risk. Another unfortunate, and I'm sorry to end on such dark news, but we are also in Marin County currently experiencing a voucher shortfall. The federal government recently cut a program that gave emergency vouchers to our system. That program was supposed to continue until at least 2035, but they are cutting it effectively basically next year. And we have 100 or so individuals or households that are under those vouchers currently. And so we are working very closely with the Housing Authority to figure out how to keep those people housed. In addition, Marin County, in part through our Home Key projects, but also out of the commitment by the Board of Supervisors to address homelessness, and this county has invested. If any of you heard the board presentation last week that we provided, this county has actually invested quite a lot in our homeless system and getting people housed. We are moving to doing temporary rental assistance to some folks in certain encampments in order to house people a little bit faster while we're waiting for new vouchers. So we are currently short about 150 vouchers, and we don't see where the next set of vouchers is coming from the federal government. So we are very, very concerned about all of these cuts. We have actually in Marin County, we currently have about 1,100 or so unhoused people. That number has declined somewhat since 2018. However, it has remained stable because we have housed our unhoused population almost 3 times over. And now we are also very concerned about what these new cuts are going to do to that progress that we've actually made.
Thank you. I want to thank our panelists today, and I'm sorry, there's so much to ask, and I think there's some incredible wisdom here. Our next panel is really going to be talking about solutions and community response, so there'll be more of an opportunity to hear about that. But I want to thank everyone up here today for sharing, for being honest, for calling us into this work together. I am grateful for your leadership. Thank you. Yeah. Oh, there is. Oh, okay. Apparently there is one last question, so sorry about that. Please continue.
Thank you. My name is Bobby Dean Evans Jr., and I'm a social worker intern at Public Authority of Marin. And I just want to, again, recognize the burden that we're carrying, the work that we're doing and have done and shall do. And I want to ask, what part of self-care, right? And how do we recognize self-care? What are we doing in our agencies? I'm glad to talk to heads of departments and offices. And what do we do with self-care in the office? How often? And if not, what's the plan? Because we know that we gotta breathe. This is heavy today. I need a hug right now. You know, and laughing is so good. Laughing is so good. And interaction with one another is so healthy. So we gotta have this time to do self-care. And as executives, CEOs, and directors, and all that, I encourage you to bring it to your offices. Thank you.
May I address?
Would anyone like to highlight?
So
Let's go for it. We're just riffing now.
I know we're getting out of time, but I appreciate that question because it's something that has always been in the forefront of my mind for staff, because I didn't say it today, but I think as we're thinking about everything that's going on, we have to think about the people who are taking care of the people, right? Because it's so important. And so we're actually going on a campaign. You know, people save up their PTO because I can't take off because we're short. I can't take off because the supervisor is going to look at me in a certain way. And so we're actually on a campaign to say, it's okay to say you want to take off. You don't need to make up an excuse. Just say, I need a day off. I need to be able to do that, and especially in this time. And we're really going to be looking at how much time people are accruing it, and we're talking to our managers about encouraging people to take the time off. We are talking to someone in our new employee, happens to teach yoga. So we're going to have her do some energy exercises with our staff where people can just come and volunteer to do that. So self-care is very important. I really, really appreciate that question. And we are looking at it because our most important commodity is the human factor, right? The people who do the work. It's not just about taking care of clients and patients. If you cannot take care of the people who work for your organization, you're not doing your job. And so I totally support and being very active in how we look at self-care.
I love that. Thank you. Yes, go for it.
So you may have noticed earlier when Dr. Warhos asked if any of us threw out food, I did not put up my hand. And that is because the food bank has been in a perpetual state of potluck this past week. So I haven't been buying groceries or eating at home. But so it's an invitation. And I was recalling with Carrie a meeting where she brought bagels to the meeting. And I remember that sharing of food and connecting with people in our workspaces, in our community. So my invitation is to consider how you too can be in a perpetual state of potluck in your workspaces to build community and connection and care with your colleagues, because sharing food and connecting over food in this moment creates that moment of care and connection I think we all need right now.
Yes. My final succinct way of summing up, you cannot do the work of racial and economic justice out there in the community unless you do the work of equity and well-being in your own house.
Well, that was a way to end the panel.
Maria, I have just a couple more. One is we got locked doors, you know, because it really is dangerous out there right now. And our staff called upon management to say, we feel unsafe. We want to feel safe, more safe in the workplace. So we actually have locked doors now. We added a wellness bonus for our staff. And our employee advisory committee is now advising more about staff, about what they would like. So we have a lot of wellness as well. So I agree. We need to take care of the people who are doing this work. Thank you.
Lovely. Thank you all so much. For those of you who are on the next panel, please, you can remain seated. And those of you who are in the audience in the next panel, if you'd like to make your way up to the stage. As our next panel gets ready, I just want to share that this is, our next step. We've heard it. We've heard some real joyful moments, some real moments of how people are sustaining. We're going to go deeper into that. We're going to really explore how we're supposed to build an action plan as a community. What are we doing to sustain ourselves and the services and supports that make up our Marin community? And so I am so excited to welcome our panelists here today. We have multiple sectors represented, and I'm going to ask each one of you to go down the line and just share your name and what sector you're representing, if possible. Carrie, do you want to start us off? Is it working? It should be working. Thanks.
Hi, good morning. I think it's still morning. I'm Carrie Bierman. I am the Social Services Director for the county. Dr. Lisa Varhus, the previous panel member, is my wonderful boss, so I report under the Health and Human Services Department.
Pedro Toledo, Chief Executive Officer of Petaluma Health Center, which operates clinics in West Marin, and also the chair of the California Citizens Redistricting Commission, which, you know, redrew the lines for the state of California, and for both the Assembly, for the State Senate, for the U.S. House of Representatives, as well as State Board of Equalization.
Okay, now I'm following Pedro. Okay, thank you, Pedro. Michelle DePass, Chief Community Impact Officer for Marin Community Foundation.
Hello again, Chandra Alexander, CEO of Community Action Marin, representing the nonprofit and social services sector.
Hi everyone, I'm Valeria Bravata. I'm Director of Programs of West Marin Fund, so we're in the philanthropic sector.
Great. We heard a lot from providers, and there's some more provider questions ahead, but I wanted to start us off with some of the funders at the table today. Really looking at sort of, you've heard what people are saying, we heard from the presentations. I would love to hear from the foundation sector. What are your thoughts? What are things that you're thinking about in this moment in time? What strategies are starting to emerge from your organizations? Anyone want to take that?
Okay, I'll go first. First of all, I just want to say how appreciative I am of the defense conversation. As a former founding executive director of a nonprofit, as someone who sits on boards of nonprofits, and also as a former federal official, I don't know if there's a worse positionality in terms of your job right now than being a government employee. So to all of our public employees in this room right now, I want to thank you. For real. You are dealing with being a ping pong ball, and it's absolutely wrong. So it's important for us to ground in the knowing, in the understanding, and the relationship around collaborative action around defense. And so thank you to First Five for putting on this forum. Thank you. I think we're all very grateful of it. But also, and in our discussion, I want to make sure that as a philanthropic leader, like you're looking, like you brought it, like what are y'all gonna do, right? It's really important for us to be discussing and in an offensive posture as well. We are going to have to do things differently. We're going to, if we keep doing things exactly the same and like standing and bolstering all of the infrastructure that is being destroyed every single minute, we are sunk. We're going to need to be in deep relationship with each other. We're going to need to take risks. We're going to be able to, we need to be committed to being able to think out of the box and do things differently. So when you ask, what are we doing? We are doing that, and we are committed to doing that. So if you're thinking like, what ideas what ideas can we bring? Sure, we at Marin Community Foundation, it's not like we had a crystal ball, but we just revamped all of our giving so that we give 3 years, no questions asked, full operational control. You don't even have to report back, just submit something that you've done for somebody else. Like, we didn't know this was coming, but that gives some capacity, and thank God of the wisdom of our CEO of RIA to say, yeah, this is where we gotta go, and then Michelle, go do it with all of our team. So I wanna thank the wisdom of you all in community that I'm sure for many years were telling us that we needed to do this, and also thank our team for making sure that we do it. We are committed to being able to foster the network organizing that needs to happen to be able to support how we're going to come out of this even better than we came into this. And this is not just like a turnaround. This is long-term commitment to our community. We are determined to be able to support developing the alternatives. So this irresistible vision that we need to actually foster here in this county that is the third wealthiest county in the state and the sixth wealthiest county in the country, the entire country. I know my fellow county employees could actually tell me how many counties are in the United States. There are maybe thousands of them, right? We are the sixth wealthiest. So we have no excuse to not be able to support and lift up the 28% of our community that needs us, that is going to be impacted. No excuse. So Marin Community Foundation is, is this the time to go into a list of things? No. Okay, I'm going to keep it high level. But we have. I just want to say, just on the point of immigration defense, right? There is conversation about immigration reform, but right now it's defense. It's supporting the communities and the families who have to do financial and asset planning for their children. And we have already, just so you know, given out $1 million to be able to support that and are looking about what we are doing tomorrow. We will come forward with more money to be able to support our immigrant families. And I just wanted to be able to double down on that because right now, we're all in conversations about the people and with the people we care about.
Thank you. Valeria, would you like to?
Sure. Of course, we're a very small community foundation that only serves West Marin. So when we're asked of how are we going to respond to these situations, sometimes it feels really overwhelming. We don't have that much resources. I come from working in foundations that had a lot of resources. So sometimes it's like, can we do anything? And the answer is, of course, yes, we can do. And we are doing, and we can do much better, actually. I think what in that place of being a very rooted, very local foundation, what we are trying to do in face of this challenge is to reaffirm our commitment to be very responsive to what our community needs. We may have our strategy and we may have invested a lot of money in a strategic plan and this and that, but we need to go back to really opening our ears, our hearts to what our community is living. And maybe we wanted to focus on this, but no, it's not the time. We'll get there at some other point. So really being responsive, also strengthening local solutions. All these big changes at the federal level that go to the state level, to go to the county level, end up at the village level, right? And there people are just dealing with what's coming to them in many ways. They didn't have anything to do with that, and now they have to deal with it. And big shout out to our local organizations. I saw San Geronimo Valley Community Center over there, for example, who are just fabulous. And yes, they get cuts and they get roadblocks, and they are like, okay, well, let's keep working, seriously. And we have many organizations like that. Although, as I said, they didn't have a lot of voice in what's going on. They get to deal with the final results or impacts of what's happening. And us as a local funder, I think our best role is to support them and see how can we help remove those roadblocks. And they are also very big for us, but maybe we can connect you with somebody. Maybe we can lift what's going on and the incredible solutions that they come up with. I think that scarcity sometimes is like the best fuel for creativity. Like when you don't have a lot, you have to figure out other ways to do it. And I've seen that actually in my career in other foundations, working in rural settings, in very, very, very difficult societies where systems have broke down, where people know that nobody's coming to save them, that creativity just comes, and people find ways of turning things around. I remember very well a community that I visited in the Yucatan Peninsula many years ago, where they were like down the river, where the river, like the biggest river of a state, connected to the ocean. So for some changes that happened upriver that they had nothing to do with, all the trash and like all the PET bottles that were, thrown away by hundreds of other communities and cities ended up in their town, and their kids were like drowning in trash. And they were very angry for a long time, and they asked for help, and nobody's gonna come help them until they figured out, and they, in collaboration with an incredible local nonprofit, that they could get some machinery to turn PET bottles into nylon thread. And then with that, the nylon thread, they could do t-shirts. So long story short, with a little bit of support, they ended up turning that unbelievable amount of trash into becoming the provider of soccer t-shirts for the state team. And that's like, it was incredible. I'm not saying, that doesn't say that change didn't need to happen, and they participated in advocacy and other things to make that change. But the reality was that they had that trash there every day, so they could not wait for those changes to happen at the state and federal level. They had to do something. And by supporting that local creativity, life came back, right? So I think that's a role of local funders, to support that creativity, that outside of the box. I love someone who said, like, maybe we don't need a pie, maybe we need a cake or a salad, who knows? Let's just support that and lift those voices and connect with other resources. And of course, even though we're very, very local, and that's our main role, I think these times call for us to also participate at a larger stage that maybe we wouldn't normally, and add our voices and whatever weight we have to efforts to move, initiatives to be in the ballot and to be in networks that push for something. I think this is the time where we need to, those who are very local, work up, and those who are up work local and upper. Like if you're the county, you need to work with the state with the federal, and the federal with international movements. I don't know, like this is a time where we need to really get connected. Last thing I want to say, that as a local funder, I think we have a key role in providing a space for those who have resources, who want to do something and are not sure on how to do that. We are seeing our donors really trying to step up and saying, how do we do? They understand that this is the time, what Michelle said, like, there's a lot of wealth, and there's no reason why we can't step up, although there are some reasons. And I think we need to work on those reasons, making it clear for them where they can act, what's a priority, and how to do it effectively.
Wow. I'm inspired by Valeria's call to creativity, and I'm going to throw this back here to the organizations. Can you give us an example of how you're thinking creatively within your organization around these federal budget cuts and their impacts?
Sure, I'll kick it off. I would say that something that we think a lot about, I mean, Valeria just touched on it a little bit, is it's not just the programs and services, it's not just the advocacy, it's also what are people thinking about their ability to make change, and it's what are the stories people are telling themselves about poverty, for example. A lot of people, I think, in this county don't believe poverty exists here. We've heard that before. And so how do you make what's invisible visible and real to people? So a lot of the creativity that we're investing in strategically is about changing narratives and allowing the stories of the people to come front and center, for people in their own words to talk about the challenges, but from a strengths-based perspective, also talk about who they are, what they want for themselves and their families, and how they're actually achieving their dreams. And we have a number of really powerful videos that we're sharing in community and will continue to share. And whether those are focused on ballot initiatives or helping to change public perception and or help to move our community forward in new and different ways, I think really centering that community voice and being really explicit about changing the narratives and the stereotypes and the tropes that we perpetuate is critically important.
Pedro.
So I'll go back to something that Chandra said earlier in the previous panel, which was encouraging voting, right? We actually, community engagement is so critical. And of course, as a healthcare provider, we employ almost 600 people who have a lot of influence with our community. They're community health workers, promotores, physicians, nurses, medical assistants. And so we've been participating in the Mi Voto Mi Salud campaign across California. Various health centers, I believe 15 health centers across the state have participated in the program, which really focused on getting our folks registered to vote, getting our patients registered to vote, and helping to influence, representation matters, helping to influence the electoral process. And at the local level, we've really seen a difference, right? We've seen measures for school bonds that barely passed, and they passed in areas where we did a lot of work to get our patients out, and because we knew that they would benefit from that. And so really energizing our community, energizing our patients, our staff, educating them about the electoral process, why it's important to vote, why it's important to be engaged, not just when there's a presidential election, but also when, on local issues around potholes and traffic and other issues that impact them, like childcare and other issues. So that's been really critical for us. We were born out of the War on Poverty, just like Community Action Partnership of Marin, and part of getting people out of poverty is making sure that their voices are counted, that they're counted in the census. The census is coming in a couple of years. It's going to be here in no time, and every person needs to be counted because that's how we get representation in the state of California. If we're not counted, we'll lose more members of Congress and more seats, and that's something that we can't afford. We already lost one. And part of that was underrepresentation, right? Folks not being counted. So we have to do everything we can to get counted in the census, to get people registered to vote, and then actually getting them out to vote to ensure that our communities, especially low-income and historically excluded communities, are represented across the state of California.
Thank you. Well, I am definitely ready to start talking creative solutions. We are doing a bunch of work internally that I'd like to talk about a little bit, but we also need a lot of help from all of you. So to add to what Dr. Varhus was talking about, our department, we've had an HR1 work group that's been going since September, just talking about the impacts of this, and then also talking about the solutions. So how many more staff will we need to do all these increased requirements? So those conversations are well underway. We have also been training our eligibility staff. So this is really important for all of you who are here today and all of us. It's really complicated, right? It's not very straightforward, if you're gonna go home and try to explain this to your family. There's so much nuance to it and different things being implemented on different dates. So it's super confusing, and it's confusing to our staff as well, even though they have the expertise in these complex program areas that are already super complicated. So we have taken really an approach to training our staff to try to get people the benefits that they're entitled to as much as possible. And we're lucky to live in a state where I think our state leaders are really in support of us, of course, following, within the parameters of the law and, the new regulations that are in front of us, but also thinking creatively and expansively. So, for example, the work requirements, that only applies to 8 to 10% of our population. So we're all talking about work requirements, and it's very bad. I'm not going to deny that. But 92% of our Medi-Cal population, they either already work or they're exempt from the work requirements. So we're talking 8%. So we really need to help our staff understand when they have a client in front of them or on the phone, how do they ask those questions so that people can say, you know, yes, I have this disability, or yes, these are the things that prevent me from work, and then we can write them in as an exemption and get that percentage even higher. The other creative things that we're doing are the automated changes that need to be made to our systems. So that's very expensive, and it's a huge endeavor, but it's very important. We heard about the CalFresh error rate, so that now the state and counties are potentially going to be charged for mistakes. So currently, California is at an 11% error rate in CalFresh. If that continues, Marin County will be subject to, I think it's $5.5 million. So we can't afford to make any mistakes, and our automated systems can help us with that so that there's no human error. So those are just a few of the things we're doing internally. Externally, I just really want to emphasize the point that we are not the trusted partner right now. So we can do a lot of messaging, and we're going to do a lot of messaging, but we need the help from all of you. Community partners, schools, clinics, who are seeing people in real time where they're at, because people are not necessarily coming through our doors. Our lobbies are a lot more empty than they were, which is really sad. But people are still showing up at schools, at childcares. So some of the messages that I think are really important, and I've been thinking a lot about this, for people who are undocumented adults, they can still enroll in Medi-Cal up until January 1st. On January 1st, that door closes, and we don't know what is going to happen. So all of the people that we have enrolled the last couple of years, they are grandfathered in. So there is still a very big opportunity in front of us to get people health coverage. We've been a little reluctant on that message just because there are a lot of concerns about data and people who come into our systems, and who is their information going to be shared with, and will themselves and their families be at risk. And we've really advised our staff not to answer those questions, right? We're not legal aid attorneys. Everybody's situation is very different. But as good social workers, it's really about putting the options in front of people and letting them decide for themselves what's best for themselves and their families. So I think that's really, really important. Just a couple other quick things. I know we're probably short on time. One of my biggest fears, I'm really frightened of a lot of things right now, but one of my biggest fears is that people will lose benefits that they're entitled to out of confusion, out of fear, because it's so complicated. So people who still are entitled to the benefits, they'll just, they'll drop off, they won't fill out their paperwork, we will lose them. And to me, that's really sad. So I know it's scary at these times to call us or to walk through our doors, but we're really relying on you as our community partners to sort of, again, put that menu of options in front of the people that you're talking with and let them know that the county is a welcoming presence. We do have a lot of diverse staff with bilingual skill set, and we are here to serve people and to give people the benefits that they're entitled to. Finally, I think there are some really, really creative ideas and solutions that we can be thinking about. So just a few days ago, Tanis Crosby, who was on the previous panel from the food bank, she emailed myself and Dr. Varhus, and she said, well, we know the work requirements are coming. What if people, your clients, volunteered with the food bank? Because you can meet the work requirements not just through paid work, but through volunteer opportunities, through enrolling in class, study, training. So those are the things we need to be thinking about, and I just loved that solution, and I think we can really do that and build on that, and it can be a win-win.
That's a very tangible solution. I want to go, we are running short on time, and I want to give us some chance to dream together and to share your dreams and visions of what sort of a collaboration, a community action plan could look like, and what your role would be in it. Would anyone like to start? It's a dream.
I'll start. I dream a lot. And I just have to say, we recognize as your community foundation in the county that we are a locus between the need and those that can resource the needs. So I just want to say, for those that might not be very familiar with how we're set up, you know that we have a side that works and stewards and holds and shepherds donors, and then we have a side to our foundation that delivers resources from the Buck Trust. And those are two legs of our stool, and we know that we are responsible to ensure that there are vehicles, that those that want to be able to fuel and energize this vision for the future have the opportunity to do so. And also to be able to help support when there are emergencies. And we are in an emergency situation in our county, as well articulated by the earlier panel. So we will be standing up a pooled fund around food. We will be standing up a pooled fund around health. It is coming. And there will be other efforts that we will need to be able to do. And the third stool, to help us understand some of those efforts, aside from being in constant community with all of you all, is our community advocates. We have brought on several people onto our team to ensure that we are in direct community with families and individuals, to ensure that we hear the voices and the need more directly. So, my irresistible vision is actually that we're talking more as a full community, and we are intending to fuel that kind of networked space that needs to happen with those that have and those that need.
Thank you. Thank you.
So I also dream a lot, all the time, and sometimes my dreams come true. So actually quite a few of my dreams have come true. So certainly for Petaluma Health Center, ensuring that everyone has access to comprehensive health care is critical. And that means everyone, right? Regardless of who you are, where you came from, what you look like, who you love. And so ensuring that the comprehensive health care is available to everyone is critical, and there is a possibility that that federally qualified health centers may not be able to serve the undocumented. Right now there's a court case, there's an injunction at this point, a temporary injunction preventing the implementation of the restrictions to our ability to serve the undocumented. So we're working very diligently to create a sister clinic structure that would be completely separate from Petaluma Health Center. Petaluma Health Center has 45,000 patients, $85 million budget, that people who depend on us, and we don't want to risk that, right? That's something that we don't want to risk. We have to make sure that we have access to healthcare for everyone. And so setting up a separate organization that can see folks who, with unsatisfactory immigration status, I hate that term, individuals who need trans care, and other individuals who will and are being restricted in terms of health care. So making sure that that access to health care remains available to everyone who needs it, and having to set up a system of care that is funded differently than what we're used to, but that is able to guarantee health care to the whole community, whether you live in rural West Marin or in San Rafael, Novato, Petaluma, Cotati, wherever in our service area, there needs to be access to health care. The other dream that I have is around our immigrant workforce. So we do have, and actually back in 2016, we implemented funding for for anybody who was a DACA recipient, anyone who was a legal permanent resident, to go down the path of becoming either a U.S. citizen or a legal permanent residency, but being able to work through that process. So and over those years, the vast majority of our employees became U.S. citizens, right? We only have 30 that are DACA at this point. They're DACA. All of our legal permanent residents became U.S. citizens. We paid for that. That was something that we were committed to as an organization, largely because we also want everyone to be engaged in their community, and we know that to be engaged sometimes and be able to vote, you have to be a U.S. citizen, right? So that was part of our commitment, and largely I also thought, the more folks that became U.S. citizens, their family members saw that, inspired them, and more folks became that over the last 10 years or so. But we have 30 DACA individuals who have not been able to become legal permanent residents or U.S. citizens, and that's where we're focusing on right now, is what can our organization do to help them. So we're working through employment sponsorship of our employees. So actually, it's very expensive, but sponsoring our employees to become legal permanent residents, which it's very expensive, but it's really important. And so we have a couple of our employees that have gone through the process. It's a scary process because you have to leave the country, and when you're a DACA, that's very scary. They've all made it back, the ones that have gone through the process. And we're very thankful to our partners, Marin Community Foundation and others, the Cornell Law School Dreamer Project, that have been helping us move our employees through that journey to become permanent residents and hopefully one day U.S. citizens.
Wow, thank you.
Sometimes I like to go after those dreams that don't cost any money. So one of the things I think a lot about, in addition to supporting the clients that we serve, is supporting the staff who work for us. And just acknowledging how traumatic it is to be implementing all of these changes and cuts that are largely negative. And I think that also goes for the community partner workforce. So I think there are all kinds of opportunities. We talked a bit about self-care, but I think as the county and in collaboration with community partners, all kinds of opportunities to come together, whether it's a support group, whether it's information sharing, whether it's a social event, but just to bring people together. And just, so that they know that they're not in this hard work alone.
I realize it is a little past noon, but if you could give us maybe 10 more minutes and then we'll close out, that would be wonderful. Thank you.
Okay. Dream, vision. Well, that we survive. I mean, that's seriously, that this lasts only 4 years, right? Like there's no way on earth this continues. That's one key thing I think we need to focus on, that we survive, as I say, and by we survive, I mean us as people who are deep in this work, that we take care of ourselves, that we get the hugs that we need when we need them, because we're going to be very important in the reconstruction, too. Also that we survive, that our institutions survive, that we protect as much as we can of our, public goods that we, took so long to get. Another part of my vision is that we, of course, learn new ways in this crisis. We learn how to streamline, to collaborate better, to find creative solutions, to collaborate, across sectors, across levels, And because that, again, will make us stronger after, right? Like what doesn't kill us make us stronger, it's true, right? Like seriously. And maybe that this horrible experience also makes us gain perspective of just how fragile some of our wins really are, our wins as humanity. And, but also how resilient we are. Like this is not the first place or the first time that this has happened. It's not. A lot has been lost. A lot of suffering has happened all around the world. But they haven't won, nor they ever will, ever. We, the people, are the overwhelming majority. And sometimes, when things are good, we get distracted. But, this is a reminder. And when we get reminded, and we get together, and we get organized, we pull back. We push back, sorry. We push back. Yes, yes. And it's painful, and it's horrible, but when we push back, that's how we've won everything in the past. Nobody gave us human rights willingly. Nobody gave us, health and SNAP or whatever. No, that was won. But was won after we pushed back after a crisis. One of these horrible crises when they think they can win. They cannot win, we will push back and we will win, yeah.
Thank you. I would only say that I think what this inspires for me is the recognition that we're building a movement, and we have to say yes to building that movement, that individual agency and action matters. Coming together, we talked in the last panel about the power of partnership, trust, relationships, caring, compassion, self-care, all of those different components, and Valeria, you said it really well. We know suffering, we've known ease, but at the heart of hearts, and whether it's in a budget presentation about what's reflected in a budget is our values, it's about what we care most about and how we live that each and every day. And so to be authentically who we are, as we're taking those steps forward, we are building a movement, and that movement is anti-poverty movement, that is accepting of our community, that is all of the things I think that we've touched on today, but we're fighting for democracy. We know that. That's how we started this time together with one another, and I think that to help support one another in knowing that what we do matters, what we say matters, how we show up matters, and those are the actions we can take and must take.
Whew, on that note, thank you so much. Oh, Pedro, do you have one?
I just wanted to say one thing. I'm actually reminded of the late, great congressman and civil rights hero, John Lewis, right? What he said about, that we will find a way to make a way out of no way. And that really feels and embodies what we're doing here in Marin County to find a way to ensure that everyone in our community can be their full potential, right? And live healthy and long lives. No matter if you're in West Marin or in the Canal or Novato or other parts of the county, that we all have access to what we need to really thrive. And so I'm just so grateful to be part of this community, Maria, for your leadership, the leadership of the Community Health Center, the leadership of all of the leaders in the room, Marin Community Foundation in our county. And it's just such a wonderful place to be because it's such a collaborative community where anything can happen. We can solve the most entrenched problems together. And none of us are going to do it alone. It's going to be together with all of us working collaboratively. So thank you so much.
Thank you. Wow. This has been a heavy morning into afternoon. I'm grateful for all of you for sticking with us. I'm grateful to the incredible visionaries that we have in front of us, in the audience, and in the broader community. I think we can do this. We can support our community, and we can do this together. Thank you all so much.